Senator Hill, please proceed with SB 793.
Thank you very much, Mr. Chair. And colleagues, thank you for the opportunity to present SB 793. Hundreds of thousands of kids in California will die a premature death at the hands of big tobacco. We are allowing them to hook and kill our kids with sweet mint, menthol, and candy-flavored poison. It would be easy to focus this bill on just vaping. That would be the easy way out. And that is what big tobacco will tell you solves the problem. A vaping bill ignores big tobacco's history of destroying and devastating our communities. Vaping only is a regressive approach that hurts kids more than it helps them and undercuts policymakers, families, and kids in all of your districts that have already established or will soon enact stronger local rules. The rampant e-cigarette use by young people is well known. It has wiped out years of declining use of tobacco in all forms by young adults, teenagers, and children. I am disgusted and troubled by this, but not surprised. Big tobacco has preyed on youth for generations, luring our most vulnerable populations with aggressive marketing, false promises of safety, and kid-friendly flavors. We must break big tobacco's death grip on our children. It is important to underscore the explosive popularity of flavored nicotine products and the role that they play in addicting new users. 80% of youth who use tobacco in any form say they started with a flavored product. What drew them and continues to hold them? Well, the overwhelming majority of teens that use tobacco report that it's fruit, menthol, and mint flavor. Big tobacco says flavors like Hawaiian Punch cater to adult tastes, but the data shows that flavored tobacco use is substantially higher among youth and young adults. Menthol cigarettes, sweet cigars, candy vapes, and other flavored tobacco products mask the harshness of tobacco and hook users into a life-threatening addiction. Before I go further, I want to explain why I'm pressing forward with SB 793, given everything we face due to the COVID-19 pandemic. I know we have all had to reassess our priorities. Yet emerging evidence about smoking and COVID-19 suggests that smoking can put people at greater risk. The World Health Organization, the CDC, and CDPH warn that tobacco use can increase the risk of suffering the most severe symptoms of COVID-19. We know conclusively that smoking increases risk of respiratory infection, weakens the immune system, and is a major underlying cause of lung disease, heart disease, and diabetes. This pandemic compels us to urge smokers to quit and establish policies that ensure youth never pick up the habit in the first place. Because of the tobacco industry's tactics, low-income neighborhoods, people with mental illness, the LGBTQ+ community, Latinos, and African Americans are disproportionately burdened by tobacco-related morbidity and death. Opponents of SB 793 claim menthol cigarettes and cigars are not hurting our youth. We know that is not true, and so does big tobacco when it preys on our kids with menthol and flavored cigars. It would be a failure on our part if we cower to big tobacco with regard to these dangerous products. Menthol, the original candy flavor, is driving tobacco-caused deaths and diseases nationwide. The cool, refreshing taste of menthol, touted by big tobacco marketing makes it easier to smoke and get addicted. Youth smokers are more likely to use menthol cigarettes than any other age group. 57% of high school smokers use menthol cigarettes, compared to less than 1/3 of smokers ages 35 and older. Because of predatory marketing to the black community, 85% of African American adults and 94% of black youth who smoke use menthol products. 45,000 African Americans die from a smoking-caused illness each year. An estimated 1.6 million African Americans under the age of 18 will become regular smokers, and about 500,000 will die prematurely from a tobacco-related disease. The fact that menthol cigarettes are often cheaper in communities of color is clear evidence of big tobacco's heartlessness. Cigars are the second most popular tobacco product among youth smokers. The overwhelming majority of youth cigar smokers, 72%, report using a flavored product. Small pack sizes, prices as low as 99 cents, and flavors like banana smash, tropical ice, and boozy watermelon make cigars particularly attractive to kids. In their own lobbying materials, premium cigar manufacturers state that their products do not contain flavorings or other additives that are found in other tobacco products. If that is the case, premium cigars are not banned by SB 793. The bill bans characterizing flavors in tobacco products, but only those that result from the addition of an ingredient other than tobacco. Another argument opponents of SB 793 are making is that flavored tobacco bans that include menthol cigarettes will criminalize tobacco possession and give law enforcement an excuse to harass communities of color. Colleagues, this is simply not true. If it were, my name would not be on this bill. SB 793 does not penalize possession of tobacco products and does not create any criminal penalties whatsoever. I was proud to support the historic tobacco reforms we enacted in 2016, which removed penalties for possession and made our tobacco control laws more equitable. In reality, the tobacco industry, knowing this is a wedge issue, has urged me to get tough on kids who use tobacco products by reestablishing draconian penalties. I have drawn a clear line in the sand. Enforcement should be focused on the tobacco industry, not their victims. Opponents are also using at best inflated and at worst made-up economic estimates to undermine SB 793. Big Tobacco has put a price on our kids' lives, but I refuse to do so. SB 793 will be a public health victory for California. We will protect against another generation getting addicted to these deadly products, which is priceless. Here are our hard facts about Big Tobacco's impact on our economy and on public health. The annual care cost caused by smoking in California alone is 13. I'm sorry? No. Here are the hard facts about Big Tobacco's impact on our economy and on public health. The annual health care cost caused by smoking in California alone is $13.29 billion. Medi-Cal costs due to smoking amount to $3.58 billion a year. Lost productivity due to smoking costs $10.35 billion a year. And here's the human toll, colleagues. Over 25% of cancer deaths in California are attributable to smoking. 40,000 adults die each year from their own smoking. And over 440,000 kids, now under 18, will die prematurely from smoking. And what scares Big Tobacco the most about SB 793, the fact that restricting the sale of menthol and candy-flavored tobacco products is an effective means to curb youth smoking and promote cessation. SB 793 takes swift action to protect youth and vulnerable populations by prohibiting the retail sale of flavored tobacco products. The tobacco industry has a target audience. Over 90% of smokers, colleagues, start before the age of 18. And the average age of a new smoker is 13. Enticing flavors, colorful packaging, and names and logos similar to popular types of candy have been used since I was a child to get kids hooked. Big Tobacco weaponized decades of treachery to lure a new generation to nicotine addiction. It is time we break that cycle. Members, I know it is easy to say this is about vaping, so let's tackle vaping only. Over 80 local jurisdictions have passed flavor bans that go beyond vaping, and every day more cities and counties are taking on the fight against Big Tobacco. Passing a state bill that is vaping only or makes dangerous exemptions actually does less to protect kids than the status quo. Doing so undermines the hard work of our cities and counties and empowers Big Tobacco to undo stronger local protections, citing the state's actions. Put differently, passing a vaping-only bill may protect some kids in the suburbs, but it does nothing to protect kids in the most vulnerable communities that big tobacco has been targeting for generations. I simply will not sell out our youth. Colleagues, I have two witnesses in support, Mr. Chair. One, Dr. Philip Gardner, co-chair of the African American Tobacco Control Network, and the second witness, the Reverend John Cager III, president of the Los Angeles Council of Religious Leaders, pastor of Ward African Methodist Episcopal Church in Los Angeles. Thank you.
Thank you very much, Senator Hill. I'll ask the moderator to hopefully find out there in the queue Dr. Philip Gardner and the Reverend John Cager.
Reverend Cager, your line is open.
I'm here.
Great, thank you. Witnesses total will have witnesses for will have a total of 6 minutes. Witnesses opposed will have a total of 6 minutes, and we'll be holding to that very strictly. So please proceed when you're ready, Reverend.
Good afternoon, Mr. Chair and members of the committee. My name is Reverend John E. Cager III. I'm the senior pastor at Ward African Methodist Episcopal Church. Thank you for giving me the time to speak today on this important bill that will save lives. You've heard from Senator Hill on the importance and need for SB 793. Let me share with you what I see in the community and why we need to ban the sale of all flavored tobacco products. First, a little background on me. I began my career in ministry at First AME Church in Los Angeles, where I was director of the youth ministry. I've held many leadership roles within the church and the community. And as the president of Los Angeles Council of Religious Leaders, I am very convinced that we need to focus on issues of health and well-being. In my own family history, my dad grew up picking tobacco in Virginia, and what he told me about picking tobacco is that tobacco is very slimy and sticky, and it fouls everything that it touches. That's the same thing with this debate. Tobacco fouls everything it touches, including the arguments that we deal with on this issue. Some will say that banning menthol is a social justice issue, and they'll bring up the Eric Garner situation. I can't say that there won't be a situation where perhaps one person has a negative encounter with police over a menthol ban. But I can say that hundreds of Californians will die every single year from lung cancer. Hundreds of black Californians will die. Some will say that it's a budgetary issue. People will just go to Arizona or to gaming reservations to get menthol cigarettes, and the state will lose out on revenue. I'm sorry, I don't want the state to collect blood money on the backs of dead African Americans, so I reject that argument. Some say that's a choice issue. They should let black people choose to smoke mentholated cigarettes if they want. I would just say opioids are a choice issue as well, but I would be thrown out of your chamber if I suggested that we allow white people to use opioids because that seems to be their drug of choice. It's completely racist to say that black people lack the self-discipline to avoid smoking mentholated products if they have to go on the black market. My denomination, the AME Church, 6,000 churches, 3 million members worldwide, including 100,000 members in the state of California, have already approved an international ban on menthol and flavored tobacco. I urge the Assembly to do as well. Thank you. Do the right thing.
Thank you very much, Reverend. Our next witness, Dr. Philip Gardner, if you're out there.
Yeah, hello?
Please go ahead, sir.
Yeah, my name is Shoaib Pollard. I'm calling from Zubida, Minnesota.
I'm sorry, you were looking for Philip Gardner. I'm sorry, you're not in the queue at this point. Oh, I'm sorry. Are you in? Okay, please go ahead. How do we get him turned on? Oh, who was that? I wasn't even paying attention.
Dr. Gardner, if you're on the line, please press 1 then 0 at this time. And I don't see Dr. Gardner queuing up.
Is Dr. Gardner in any of the other witness rooms? Or just on the phone? Dr. Gardner's not in the chamber. Wait just another minute. I know there are a lot of people in the queue, so this is a challenge. So Dr. Philip Gardner, if there's a way for the moderator to identify Dr. Philip Gardner, we'd love to hear that.
Once again, Dr. Gardner, if you're on the line, please press 1, then 0 at this time.
I don't think so.
And I don't believe we have him on the line.
Okay, Dr. Philip Gardner, if you're still out there at some point, please keep trying. At this point, we will actually go to other witnesses in support. We'll just your name and organization only. So, Madam Moderator, you can open the line for witnesses in support, name and organization only, and if Dr. Philip Gardner is able to find his way back on, we will gladly stop that testimony and allow Dr. Philip Gardner to speak. So please go ahead with witnesses in support, name and organization only.
And ladies and gentlemen, as a reminder, to show support of SB 793, please press 1, then 0 at this time. First, we'll go to line number 146. Your line is open.
Fremont Unified Trustee Ann Crosby calling from Stop Poisoning Children in support of SB 793.
Thank you.
Line 389, your line is open.
Hi, this is Brianna Pittman-Spencer with the California Dental Association. We are in support of this bill without any exemptions. Thank you.
Thank you.
Line 441, your line is open.
This is Cristiana Dominguez on behalf of Attorney General Javier Becerra in support.
Thank you.
Line 450, your line is open.
I'd like to speak in opposition, please.
We're doing support.
Okay, so I'll take myself off this queue.
Thank you.
Line 359, your line is open.
Hello, Chair and members. Benjamin Tran with the California Pan-Ethnic Health Network in strong support.
Thank you.
Line 426, your line is open.
Good afternoon. Nicole Wortelman on behalf of San Bernardino County in support.
Thank you.
Line 356, your line is open.
Good afternoon, members. Matt Robinson with Kaiser Permanente in strong support with the bill as is with no further exemptions. Thank you.
Thank you.
Line 504, your line is open.
This is Mara Morton with the California Children's Hospital Association in support of SB 793.
Thank you.
Line 511, your light is open.
This is Tim Madden, representing the California chapter of the American College of Cardiology and the California chapter of the American College of Emergency Physicians in support.
Thank you.
Line 445, your line is open.
Hi, this is Dr. Kathy McDonald for the California Society of Addiction Medicine, CSAM. We support SB 793, but would withdraw support if amended to a vaping-only bill.
Thank you. Just your name and position on the bill as it's written. Thank you.
Line 494, your line is open.
Good afternoon, Mr. Chair and members. Connie Delgado on behalf of the California Emergency Nurses Association in support of the bill.
Thank you.
Line 488, your line is open.
Abigail Ramirez with the Latino Coalition for a Healthy California in support.
Thank you.
207, your line is open. Your line is open.
Hello, MJ Diaz here on behalf of SEIU California and our 700,000 members in strong support and apologies for the late support.
Thank you.
Next, we'll open line number 616. Your line is open.
Erica Hoffman on behalf of the California School Boards Association in support.
Thank you.
Next, we'll open line number 60. Your line is 060. Your line is open.
Amber King with the Association of California Healthcare Districts in support.
Thank you.
Line 584. Your line is open.
Priscilla Quiroz on behalf of the California Academy of Child and Adolescent Psychiatry in support.
Thank you.
Line 158. Your line is open.
Hi, Elizabeth Belton, Alameda County Tobacco Control Coalition member and mother in support of 793 if not amended.
Thank you.
Line 72, your line is open.
I don't even know what's happening now.
Line 72, your line is open.
Oh, hi, this is Tricia Barr. I'm a member of the Parent Teacher Association, the PTA. I'm in strong support of Bill 793. I have some names of others who tried to get on and weren't able to. Can I list their name and position?
Yes, I'll allow that. Thank you.
Thank you. Grace Ma, Santa Clara County Board of Education trustee. Joan Lambert, former school board member. Andrea Luskin, school site council. Lama Ramawi, pediatrician. Julie Thal, Kelly Baird, parents.
Great.
Thank you.
Thank you very much.
Line 417, your line is open.
Hello?
Your line is open.
Hello? Yes, but I was not on the one to be supporting. I'm on the opposition side, and the operator gave me this number 417. So how do I get read back connected?
I think it's a miss.
When we do opposition, you can queue up by pressing 1 then 0.
Okay, thanks.
Next, we'll go to line 144. Your line is open.
Hi, this is Blythe Young from the American Heart Association in strong support without exemption.
Thank you.
Line 352, your line is open.
Diana Douglas with Health Access California in strong support. Thank you.
Thank you.
Line 264, your line is open.
Lucette Short on behalf of the Association of Northern California Oncologists in support.
Thank you.
Line 322, your line is open. 322, your line is open. With no response, we'll move on to line number 656. Your line is open.
Hello?
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 Yes, are you speaking in
Can you
support?
hear me?
Line is open.
I'm actually in opposition too. Things a mess.
Well, you can press 10 and you'll be placed back in the queue. And then when we call for opposition, you'll be allowed to be back in the queue.
Line 339, your line is open.
Kelly Brooks on behalf of the County Health Executives Association of California in strong support.
Thank you.
Line 536, your line is open.
Hi, Nikia Mariwatu. I'm a senior in high school. I'm part of the Stanford Tobacco Toolkit Youth Advisory Board in strong support.
Thank you.
And we've located Dr. Gardner. May I proceed by opening his line?
How do
Mr.
I
Chair?
do that?
Mr. Gardner,
Hello?
your line is open.
It's not allowing me to open.
We can hear you.
Is this Dr. Gardner? We can hear you.
Hello? I can't hear you.
You cannot hear us. We can hear you.
You can hear me now?
We sure can.
Okay, I'm very sorry, whatever the technical difficulties are. Good afternoon. I'm Dr. Philip Gardner. I'm co-chair of the African American Tobacco Control Leadership Council. We strongly encourage the committee to pass Senate Bill 793 Let's be quite clear in the beginning. Menthol cigarettes and flavored little cigars have been and are the main vectors of death and disease in the Black, brown, and other poor communities of color. COVID-19 pandemic has just underscored the health disparities and unequal treatment faced by poor communities of color for hundreds of years in the United States. At this time, nothing could be more helpful in saving Black lives and ensuring that Black lives matter than getting menthols and flavors out of California. Some Black groups spurred on by the tobacco industry have been spreading falsehoods stating that prohibiting the sale of menthol and flavored tobacco products, including flavored e-juices, will lead to the criminalization, particularly of young Black men. Nothing could be further from the truth. SB 793 would prohibit the sale of flavored products. The bill would not prohibit the possession of these products. These same groups rail about the unintended consequences. I want the committee to actually look at the intended consequences. Black folks die disproportionately from tobacco-related disease of heart disease, lung cancer, stroke, and other racial and ethnic groups compared to other racial and ethnic groups. Menthol cigarettes and flavored little cigars are the agents of this destruction. Still, other groups funded by the tobacco industry argue that removing menthol cigarettes and flavored little cigars would take away, quote unquote, our cigarettes. We'd be discriminatory. This line of argumentation stands history on its head, and it was in the tobacco industry that predatorily marketed these products to the Black community. The facts are these. There are more advertisements, more lucrative promotions, and menthol cigarettes are cheaper in the Black community compared to other communities, and we have loads of data on this. This is how flavored death sticks became our cigarette. On June 1st, Massachusetts became the first state in the nation to prohibit the sale of all flavored tobacco products. There are already 60 cities that have done this across the nation. No Black market has developed. The California State Committee on Health needs to be exactly that, the Committee on Health. Put the health of California's residents in the forefront of your thoughts, not the interests and the profits of the tobacco industry. This is not the time for half steps. Rather, it's the time to take a stand for the public's health and declare that in the midst of the COVID-19 pandemic, there is no better way to save Black lives, nay, all California lives, than to get menthol cigarettes and flavored little cigars, the main vectors of death, disease, and the coronavirus, out of California. Please pass SB 793 with no exemptions.
Sure. Great. Thank you very much, Dr. Gardner, and thank you very much for your perseverance in getting through and being able to provide your testimony. It's much appreciated. Madam Moderator, you may go back to others in support. We're just looking for name and organization only. So please go ahead.
Thank you, sir. Thank you. Next, we'll open line number 433. Your line is open.
Chair members, Kathy Mossberg, representing both the First Five Association of California and the Public Health Institute, both in support of SB 793. Thank you.
Thank you.
Line 163, your line is open.
Hi, my name is Aditya Indla, and I'm a junior in Bellarmine College Prep High School. And I'm also an ambassador for the Campaign for Tobacco-Free Kids, and I strongly support banning all flavors from all tobacco products. Thank you.
Thank you very much.
Line 532, your line is open.
Hi, my name is Lisa Liu, freshman at Stanford. I'm representing International Youth Tobacco Control and Campaign for Tobacco-Free Kids. Strongly support SB 793 as is with no exemption. Thank you.
Thank you.
Line 340, your line is open.
Hello, my name is Cameron Meyer, and I live in the city of Danville, and I'm in the 11th grade. I support banning all flavors from all tobacco products. Thank you.
Thank you.
Line 28, your line is open.
Yes, hello. This is Isa Abueda with the Hookah Chamber of Commerce in strong support of SB 793.
Thank you.
Line 607, your line is open.
Thank you, Gianna Sachude, on behalf of the City of Alameda in support. Thanks.
Thank you.
Line 649, your line is open.
Hi, Susie Larry Hall, Chair of the Nicotine Action Alliance of Butte County, and also Community Outreach Coordinator for Inlow Medical Center, both in strong support of SB 793. Thank you.
Thank you.
Line 419, your line is open.
This is Tim Gibbs with the Campaign for Tobacco-Free Kids, proud co-sponsor with no exemptions. And Mr. Chair, could I read 4 more organizations that could get on?
Additional organizations in support? Yes.
Yes. Public Health Advocates, Community Alliance for Fontana Students, Wellness and Prevention Center, and Thomas Teresa's Executive Director of the American Academy of Pediatrics, California chapter, representing 1,500 pediatricians in strong support of the bill as is without amendment exemptions. Thank you.
Okay. Thank you.
Line 79, your line is open.
Thank you. Ann Wheelis, American Heart Association volunteer, on behalf of Monterey County Collaborates, urging strong support of SB 793 as presented by Senator Hill. Thank you.
Thank you.
Line 103, your line is open.
Hi, this is Chelsea. I'm part of the student-led nonprofit International Youth Tobacco Control, and I strongly support SB 793 as is with no exemptions.
Thank you.
Line 448, your line is open.
Shane Silva, representing the California State PTA in support of SB 793.
Line 578, your line is open.
Good afternoon, Franklin Chang, senior at LaSalle High School and part of the student-led nonprofit International Youth Tobacco Control, in full support of SB 793 without exemption.
Thank you.
Line 147, your line is open.
Hi, my name is Jill Whittam. I'm a parent and biotech professional from Sonoma, and I strongly support SB 793.
Thank you.
Line 403, your line is open.
Good afternoon, Chair and members. Dane Hutchings, representing the cities of Belmont and Redwood City, in strong support of Senate Bill 793, as currently in print. Thank you.
Thank you.
Line 424, your line is open. Line 424, your line is open.
Hi, my name is Lori Bremner with Parents Against Vaping E-Cigarettes, California, and I'm in strong support.
Thank you.
Line 660, your line is open.
This is Indy Sednu. I'm a parent of 2 teens in California. I also support Flavors Addict Kids from Livermore, California, and I am in strong support of SB 793. Thank you very much.
Thank you.
Line 531, your line is open.
Kat DeBerg with the Health Officers Association of California, in support.
Line 613, your line is open.
Yes, this is Nicolo DeLuca on behalf of the cities of Oakland, Berkeley, San Leandro, Palo Alto, and San Pablo. Strong support as the bill is currently written. Thank you.
Thank you.
Line 110, your line is open.
Amy Bailey, a parent with the Anti-Vaping Alliance. We're in strong support of SB 793.
Thank you.
Line 502, your line is open.
Thank you, Mr. Chair and members. Erin Taylor on behalf of the counties of Alameda and San Mateo.
Thank you.
Line 416, your line is open.
Good afternoon, committee. My name is Ayush Verma. I live in the city of Sacramento, and I'm in 10th grade. I support banning all flavors from all tobacco products. Thank you.
Thank you.
Line 643, your line is open.
Mr. Chair, members, Bryce Doherty with KP Public Affairs on behalf of the California Academy of Family Physicians in strong support.
Thank you.
Line 621, your line is open.
My name is Jim Murphy. I live in the city of San Jose, and I support banning all flavors from all tobacco products. Thank you.
Thank you.
Line number 443, your line is open. They removed themselves from queue. Line 423, your line is open.
Good afternoon. My name is Raj Dillon, representing Breathe LA, in strong support of SB 793 without further exemptions. Thank you.
Thank you.
Line 274, your line is open.
My name is Rob England, and I work in health management, and I am in strong support.
Thank you.
Line 510, your line is open.
Good afternoon. My name is Linda Evans. I'm a Gammy of 3 little children. I live in the city of El Cajon, and I support banning all flavors from all tobacco products. Thank you so much.
Thank you.
Line 155, your line is open. Line 155, your line is open.
Good evening. My apologies for previously speaking on the incorrect queue. This is Lydia Leasting, representing Kinfolk Project Ministries, and I strongly support SB 793.
Thank you very much.
Line 661, your line is open. Line 661, your line is open. With no response. Oh, please go ahead.
This is Linda Shaner from Imperial, and I strongly support banning all flavors from all tobacco products. Thank you.
Thank you.
Line 563, your line is open.
Hello, my name is Rima Corey with the Hooker Chamber of Commerce. I strongly support SB 793. Thank you.
Thank you.
Line 429, your line is open.
My name is Meredith Berkman. I represent the National Organization of Parents Against Vaping E-Cigarettes, and we are in strong support of SB 793 as is. Thank you.
Thank you.
Line 90, your line is open.
Hi, I'm Vinita Verma. I'm Fremont Council PTA President and a parent of 2 teens, and I'm in very strong support of SB 793. Thank you.
Thank you.
Next, we'll open line number 469. Your line is open.
Hi, my name is Becky Rapp. I'm a mother and youth group mentor, and I strongly support SB 793. Thank you.
Thank you. Thank you.
Line 430, your line is open.
My name is Brian Davis, resident of San Francisco, in strong support without exemptions.
Thank you.
Line 95, your line is open. Line 95, your line is open. With no response, we'll move on to line number 34. Your line is open.
My name is Keaton Kovac. I am in strong support of SB 793.
Thank you.
Line 615, your line is open.
Karen Bates, parent and member of the Anti-Vaping Alliance. I give my full support of SB 793 as is without exemption.
Thank you.
Line 622, your line is open.
Yes, my name's Kathy Flaherty. I'm a parent of 3, a grandparent of 6, and I live in the city of Atwater, and I support banning all flavors from all tobacco products. Thank you.
Thank you.
Line 612, your line is open.
Yes, Mr. Chair and members, Nick Romley on behalf of the California State Alliance of YMCAs, the California Alliance of Boys and Girls Clubs, San Bernardino County District Advocates for Better Schools, and also on behalf of the Santa Clara County Office of Education, all in support.
Thank you.
Line 54, your line is open.
Hello, my name is Amanda Temple, resident of Long Beach, California, and I am in strong support of SB 793. Thank you.
Thank you.
Line 514, your line is open. Line 514, your line is open. With no response, we'll move on to line number 541. Your line is open.
My name is Sam Hannon with the Hookah Chamber of Commerce. I strongly support SB 793. Thank you.
Thank you.
Line 119, your line is open.
Hi, my name is Agamar Kaur, and I'm a junior at Doherty Valley High School, and I strongly support Bill 793 as is with no exemptions. Thank you.
Thank you.
Line 152, your line is open.
My name is Paul Radu, and I'm with the Hookah Chamber of Commerce. I support SB 793. Please pass the bill and protect hookah. Thank you.
Thank you.
Line 461, your line is open.
Honorable Chair and members, Amanda Miguel Staples, member of the Los Angeles County's Community Prevention and Population Health Task Force, in support.
Thank you.
Line 439, your line is open.
This is Rachel Grass-Lazarus with Alameda County Tobacco Control Coalition and parents in strong support as is with no exemptions.
Thank you.
Line 460, your line is open.
Hi, my name is Irene Sim. I'm the VP of Health and Wellness on the Palo Alto PTA Council, as well as a clinical pharmacist. I strongly support this bill with no exemptions.
Thank you.
Line 626, your line is open.
This is Christy Wong, co-founder of Flavors That Dig Kids Livermore. We strongly support SB 793 with no exemptions.
Thank you.
Line 341, your line is open. And 341, your line is open.
Hello?
Yes, please go ahead.
Please go ahead, sir.
My name is Ronnie. I'm with the Hookah Chamber of Commerce, and I'm in support for SB 793.
Thank you.
Line 49, your line is open.
My name is Trini Wong. I live in Irvine, and I support the bill. Thank you.
Thank you.
Line 75, your line is open.
Hi, I'm Jean Liu. I'm a parent with Spring Valley PTA, and I'm in support of SB 793 as is.
Thank you.
Line 31, your line is open.
Hi, this is John Nador, Hookah Chamber of Commerce, and support this bill.
Thank you.
Your line is open.
Hi, I'm Pranam Medida, a freshman at Basis Independent Silicon Valley, and I support SB 793 as is without exemptions.
Thank you.
Line 462, your line is open.
My name is Erwin Morton, representing the Palo Alto Council of Parent-Teacher Associations, in strong support of SB 793 as is, with no further exemptions. Mr. Chairman, may I give you a few additional names of people who could not get on?
Yes, of course. Thank you.
Hello?
Yes, you may.
Thank you. Okay. Jade Chow from Palo Alto Council of PTAs in strong support. Linnell Newman, Hala Hamiasi, and Monique Morrison. All three of them are Palo Alto PTA volunteers, all three in strong support. Thank you so much.
Thank you.
Line 550, your line is open. Line 550, your line is open. With no response, we'll move on to line number 624. Your line is now open.
Mr. Chairman and members, good afternoon. Paul Yoder on behalf of the City and County of San Francisco in strong support.
Thank you.
487, your line is open.
Carol Baker, calling on behalf of the Tobacco Free Coalition of Santa Clara County. We support SB 793 as is without exceptions. Thank you.
Thank you.
Line 96, your line is open.
Hi, this is Kelsey Chambers, and I am a senior at Butte College, and I am in strong support of SB 793.
Thank you.
Line 300, your line is open. Line 300, your line is open. If your line is muted, we're unable to hear you. Moving on to line number 80, your line is open. Line 80, your line is open. Line 106, your line is open.
Good afternoon. My name is Joshua Edwards. I am a parent and I'm an outreach coordinator at the African American Family Cultural Center, and I support SB 793.
Thank you.
Thank you.
Line 306, your line is open.
Hi, my name is Jamie Escoto, and I live in the city of Los Angeles, and I support banning all flavors from all tobacco products. Thank you.
Thank you.
Line 614, your line is open.
Good afternoon, Mr. Chair and members. Maria Sperber on behalf of the California Hospital Association in support.
Thank you.
Line 472, your line is open.
Hello, this is Genesis Merriman, resident of Santa Clara County. I support the bill as is without exemption.
Thank you.
Line 312, your line is open. Line 312, your line is open.
Maria Isabel Rutledge, Community Coalition, in support.
Thank you.
Line 35, your line is open.
Hi, my name is Kirill Golovich. I live in Los Angeles and normally support SB 793.
Thank you.
Line 188, your line is open.
Catalina Sanchez with Corbin and Kaiser on behalf of Common Sense, co-sponsor who supports the version before you today. Thank you.
Thank you.
Line 229, your line is open. Line 229, your line is open. Line 634, your line is now open.
Tomas Torrices, American Academy of Pediatrics in San Luis Obispo, Santa Barbara, Ventura, Kern, Los Angeles, San Bernardino, and Riverside counties, in strong support of the bill as written without exceptions. Thank you.
Thank you.
Line 225, your line is open.
Hello, my name is Victor Liu, and I'm a sixth grader at Huntington Middle School. I'm part of the student-led nonprofit International Youth Tobacco Control. I support SB 793 as is, with no exemption to menthol cigarettes and flavored cigars. Thank you.
Thank you.
Line 456, your line is open.
Hi, my name is Dr. Bonnie Halpern-Felsher. I'm a professor of pediatrics at Stanford University, and I'm also the founder and executive director of the Tobacco Prevention Toolkit. I'm in strong support of SB 793 without exemptions. May I please read the names of a few of the youth group who cannot join?
Yes. Please go ahead.
Thank you. These are all people who are youth under age 21: Elias Misers, Nadia Alvarez, Luis Martinez, Jency Gonzalez, Brenda Rodas, Naomi Lozano, Zen Lozano, Haral Patel, and Riva Jarralo are all members of our youth board who are in strong favor. Thank you.
Thank you.
Line 136, your line is open.
Hey, this is Lisa Chambers from Chico, California. I'm the frustrated parent of a 15-year-old, and I strongly support this bill. Thank you very much.
Thank you.
Line 377, your line is open.
Good afternoon. Sarah Huckle with the University of California, Office of the President, in support.
Thank you.
Line 498, your line is now open.
Hello, this is Amanda McAllister-Wellner with the California LGBTQ Health and Human Services Network in support.
Thank you.
Line 370, your line is open.
Good afternoon. My name is Milton Nguyen, and I'm a junior at Mariloma High School. I'm also a National Youth Ambassador for the Campaign for Tobacco-Free Kids, and I strongly support Senate Bill 793.
Thank you.
Line 114, your line is open.
My name is Gisela Friedman with Parents Against Vaping E-Cigarettes, or PAVE, and I strongly support SB 793 with no exemptions. Thank you.
Thank you.
Line 661, your line is open.
Hi, my name is Ian Wright. I'm a former smoker of flavored tobacco products, and I am a student at Loyola Marymount University, and I am in support of this bill.
Thank you.
Line 588, your line is open.
Hi, my name is Prashant Naidu. I'm a junior at UC Davis in the Tobacco Prevention and Advocacy and Community Health Intern with California of the Bay Area, and I'm in strong support of SB 793 without exemptions.
Thank you.
Line 318, your line is open.
Hi, my name is Amber Weir. I am a proud parent of two beautiful children in Del Norte County, and I strongly support SB 793.
Line 62, your line is open.
Good afternoon. My name is Ruth Azanki. I live in Orange County, and I strongly support SB 793. Thank you.
Thank you.
Line 656, your line is open. Line 656, your line is open.
Yeah, I'm with the Underground Vaping Association. I'm for this bill because I'm going to make a ton of money.
Line 159, your line is open. Line 159, your line is open.
Hi, my name is Jerry Thung. I live in the city of San Jose, and I support banning all flavors from all tobacco products. Thank you.
Thank you.
Line 473, your line is open.
Hello?
Line 473, your line is open.
Hello?
With no response, we'll move on to line 217. Line 217, your line is open. Line 217, your line is open. With no response, we'll move on to line number 442. Your line is open.
Yes, my name is Michelle Reinhardt. As a mother and a teacher, I live in the city of Rancho Cucamonga, and I support banning all flavors from all tobacco products. Thank you.
Thank you.
Line 451, your line is open.
Good afternoon. My name is Addison Science with the Coalition for Tobacco-Free San Bernardino County in support of SB 793 as is with no exemptions. Thank you.
Thank you.
Line 677, your line is open.
Yes, thank you. Good day. My name is Dr. Bobby Sheffield. I'm the Vice President with the Riverside County Black Chamber of Commerce and the Inland Empire Smokeout Project. We're in strong support of SB 793 with no exceptions, and also 3 other members that could not get on that are in strong support as well. Mr. Pepe Jackson, President of the Riverside County Black Chamber of Commerce, Ms. Tammy Sheffield, Community Engagement Coordinator, and Sylvia Jackson, Community Engagement Coordinator. All 3 are in support of SB 793. Thank you.
Thank you very much.
Line 452, your line is open.
Hi, can you hear me?
Line 452, your line is open.
Hi, can you hear me?
We can.
Oh, okay. Amaya Wooding, Fremont, California. Strong support with no exemption. Thank you.
Thank you. Thank you.
Line 399, your line is open.
Michael Radigan on behalf of the Board of Supervisors of Santa Clara County, and strong support with no exemptions. Thank you.
Thank you.
Line 297, your line is open.
Hi, this is Ray Waller II, Youth Minister at Mount Zion Assembly, and we are in support of SB 793 with no exceptions.
Thank you.
Line 576, your line is open.
Hi, Alexa Warman with the American Heart Association of Orange County and Inland Empire, in support without exemption.
Thank you.
Line 554, your line is open.
Hi, my name is Andy Lau. I'm a resident of Philip Gardner. I strongly support SB 793 as is with no exemptions. Thank you.
Thank you.
Line 690, your line is open.
Jazzy Grewal with the UFCW Western States Council in strong support.
Thank you.
Line 678, your line is open.
Thank you. Puneet Purwal on behalf of Equality California in support of SB 793 as written without exemptions.
Thank you.
Line 198, your line is open.
Hi.
Hello.
Line 1.
Hello.
Your line is open.
Hi, my name is Simone Johnson. I'm in 10th grade from College Park, and I support SB 793.
Thank you.
Line 254, your line is open.
Hello, my name is Nick Brodnicki. I work for the American Heart Association, a co-sponsor of SB 793. I'm in our Bay Area office. I support SB 793 if not amended. Stop the sale of deadly flavored tobacco. Thank you.
Thank you.
Line 322, your line is open. Line 322, your line is open. Moving on to line number 364, your line is open. Line 364, your line is open.
Hello.
Please go ahead.
Hello, my name is Pierre Mansour. I'm here to oppose SB 793.
Okay, thank you. We're looking for support
Line
only at this
39.
point.
Line 39, your line is open.
Hi, my name is Moshe Heen. I work at Paramount. We urge the state to take the lead and pass SB 793, which protects the hookah culture in California. Please pass the bill and protect hookah. Thank you.
Thank you.
Line 407, your line is open.
Hi, good afternoon. My name is Dominique Molina. I am an upcoming senior at Southwest High School in Central Valley, California, and I strongly support SB 793.
Thank you.
Line 694, your line is open.
Good afternoon. This is Jamie Morgan with the American Heart Association. We are a proud co-sponsor of the bill and urge you to support the bill in print before you today. Thank you.
Thank you.
Line 691, your line is open.
Hi, my name is Carlos Leon with Community Coalition, a black and brown organization in South Central LA, and we are in full support of the bill without exemptions.
Thank you.
Line 428, your line is open.
Good afternoon. I'm Liz Williams with Americans for Non-Smokers' Rights. We support this bill without exemptions.
Thank you.
Line 431, your line is open.
Good afternoon. Donna Seitz, representing the Los Angeles County Board of Supervisors, in support. Thank you.
Thank you.
Line 572, your line is open.
This is Annie Tagan, proud member of the Los Angeles Family Spreading Flavored Tobacco Coalition, in strong support of the bill without exemption. Thank you.
Thank you.
Line 684, your line is open.
Hi, my name is Oxford Jamal, and I strongly support SB 793. I am a freshman who goes to San Juan Valley High School in Contra Costa County.
Okay, thank you very much.
Line 551, your line is open.
My name is Rodette Retta, and I'm a senior at San Marino High School and part of the student-led nonprofit International Youth Tobacco Control. I support SB 793 as is with no exemption to menthol cigarettes and flavored cigars.
Thank you.
Line 710, your line is open.
Hi, my name is Janet Rodriguez, and I'm a resident of the city of Los Angeles and a member of the Coalition for a Tobacco-Free Los Angeles, as well as the LA Families Fighting Flavored Coalition. And I support 793 as is without exemptions. Thank you.
Okay, thank you.
Line 716, your line is open.
Hello, my name is Bob Gordon, co-chair of the San Francisco Tobacco-Free Coalition, in support, as is, with no exemptions.
Thank you.
Line 61, your line is open.
Hi, my name is Nader Corey, and I'm calling in to support SB 793. Thank you.
Thank you.
Line 727, your line is open. Line 727, your line is open. With no response, we'll move on to line number 608. Your line is open.
Hi, this is Sophie Lynn. I'm a sophomore at San Gabriel High School in support of the bill.
Thank you.
Line number 712, your line is open.
Hi, good afternoon. This is Mary Badner. I'm a member of the San Diego County Tobacco Control Coalition, and I support SB 793 as is, no exemptions.
Thank you.
Line 443, your line is open. Line 443, your line is open. With no response, we'll move on to line number 751. Your line is open.
Yes, hello. This is Dorian Furman. I'm the co-founder of PAVE, and we strongly support this bill with no exemptions. Thank you.
Thank you.
Line 64, your line is open.
Yes, my name is Santiago Morales. I'm a resident of Huntington Beach, California, and I strongly support Bill SB 793.
Thank you.
Thank you.
Thank you.
Line 723, your line is open.
Good evening, Priscilla Quiroz on behalf of the City of Beverly Hills in support. Thank you.
Thank you.
Line 99, your line is open. Line 99, your line is open.
Linda Titus with the San Bernardino Coalition for Tobacco-Free San Bernardino County in strong support of 793 without exemption.
Thank you.
Line 603, your line is open.
Hi, my name is Jada Hall. I'm 17 and I go to SOTA, San Francisco School of the Arts. I fully support the SB 793 as is without exemption.
Thank you.
Thank you.
Line 506, your line is open. Line 506, your line is open.
Hi, my name is Michael Lynn, and I am an Access Ambassador and also a proud parent of 2 boys from San Mateo County, and I fully support SB 793 without any exemptions.
Thank you.
Line 753, your line is open.
My name is Jasmine Hawk, an 11th grader at Vista Lago High School, and I strongly support this bill as is without exception.
Thank you.
Line 752, your line is open.
Good afternoon. My name is Catalina Castillo. I'm a parent from San Bernardino Community Coalitions for Change in San Bernardino, California, and I strongly support banning all flavored tobacco products. Thank you.
Thank you.
Line 773, your line is open.
Alejandra Duran with Vitamin Group, representing Change for Justice and Support.
Thank you.
Line 748, your line is open. Line 748, your line is open. With no response, we'll move on to line number 780. Your line is open.
Good afternoon, Katharina Gargano on behalf of the City of Carlsbad in support.
Thank you.
Line 793, your line is open.
Hi, this is Matt Dumlau calling from the Office of Lieutenant Governor Lenny Kounalakis, calling in strong support.
Thank you.
Line 443, your line is open. Line 443, your line is open.
Can you hear me?
Yes, ma'am.
This is Ann Delcor with Parents Against Vaping E-Cigarettes and the Anti-Vaping Alliance in Sacramento in strong support.
Thank you.
Line 771, your line is open.
Good afternoon, Mr. Chair and members. This is Paula Vieskas, President of the San Juan Unified School District, and I am in strong support of SB 793.
Thank you.
And ladies and gentlemen, as a reminder, to show support, press 1, then 0 at this time. Next, we'll open line number 300. Your line is open. Line 300, your line is open. With no response, we'll move on to line number 514. Your line is open.
Hello. On behalf of Coastal Communities Drug-Free Coalition, we support SB 793 as is, without any changes. Thank you very much.
Thank you.
Line 830, your line is open. Line 830, your line is open. With no response, we'll move on to line number 816. Your line is open.
Hi, this is Arnie Abramian with Hookah Chamber of Commerce in support of this bill.
Thank you.
Line 127, your line is open. Line 127,
Hello?
Yes, ma'am.
Hello? Hello, can you hear me?
Yes,
Hello?
please go ahead.
Hi, this is Sai Medida representing the Abel project. I strongly support SB 793.
Thank you.
Line 688, your line is open.
Good afternoon. I'm Mia Hunt. I'm a sophomore at Sequoia High School in Redwood City, and I support SB 793.
Thank you.
Thank you.
Line 229, your line is open. Line 229, your line is open. With no response, we'll move on to line number 473. Your line is open.
Hello?
Yes, please go ahead.
Hello, my name is Diana Batista with Lucille Packard Children's Hospital, Stanford Children's Health, expressing strong support for SB 793 as written.
Thank you.
Line 836, your line is open.
Good afternoon. This is Twyla Laster representing SAC Cultural Hub Media Foundation in support of SB 793.
Thank you.
Thank you.
Line 779, your line is open.
Yes, my name is Janelle Gladen. I am a co-founder of Flavors Addict Kids Livermore and also a parent of 2 teenagers. I am in full support of 793 as written.
Thank you.
Thank you.
Line 768, your line is open.
This is Rosalind Payne from San Francisco, a member of Parents Against Vaping and E-Cigarettes. I strongly support Senate Bill 793 as written without exception. Thank you.
Thank you.
Line 791, your line is open.
Good afternoon. This is Lindsay Freitas, resident of Sacramento, mother of 2, in strong support of the bill as written without exemptions.
Thank you.
Line 725, your line is open.
Good afternoon. My name is Dr. Valerie Yerger, professor in health policy at the University of California at San Francisco and co-founder of the African American Tobacco Control Leadership Council. I'm in support of SB 793 as written without any additional exemptions. Thank you.
Thank you very much.
Line 844, your line is open. Line 844, your line is open. Moving on to line number 727, your line is open. Line 727, your line is open. Line 139, your line is open. Line 139, your line is open. Line 796, your line is open.
Good afternoon, and thank you for having me. My name is Eli Velasquez, and I'm calling with the TOLA Organizing Academy, and I support SB 793 as is without exception. Thank you.
Thank you.
Line 312, your line is open. Line 312, your line is open. Line 784, your line is open.
Hello, my name is Terry Ann Skelly. I'm a mother of 3 young adult men, and I strongly support SB 793 without exception. Thank you.
Thank you.
Line 775, your line is open.
Is that me?
Yes, ma'am.
Okay. Hi, I'm Melissa Russell, calling with the TOLA Organizing Academy, and I support SB 793 as it is without exemptions.
Thank you.
Thank you.
Line 322, your line is open.
Please go ahead.
Yeah. Hello?
Line 322, your line is open. With no response, we'll move on to line number 756. Your line is open.
Hi. My line is open.
I'm Pamela Granger, smoke-free Marin and tobacco-free Sonoma County, and grandparent of 5 tobacco industry targets in support of banning all flavors from all tobacco products. Thank you.
Thank you.
Line 219,
Hello?
your line is open.
Yeah.
Actually, I'm from the opposition.
I am
219. Can you put me back in the queue? I'm in the opposition.
Can you put me in the queue? I'm in the opposition.
Okay. We'll do that.
So I am opposed to SB 793.
Okay. Thank you.
Line 840, your line is open.
Hello, my name is Erica Ho, and I'm a freshman at UCLA and part of the student-led nonprofit International Youth Tobacco Control. I support SB 793 as it with no exemptions in methanol cigarettes and flavored cigars.
Thank you.
Line 651, your line is open. Line 651, your line is open.
Is that mine? I don't understand. Which is my line?
This is your line. Please go ahead.
Yeah, this is Amarjit Sagu, and I am the Vice President of APCA of North Chapter, and I am totally opposition to the SB 793. This will kill the small businesses. We are already suffering.
Thank you. Any more in support?
Line 651, your line is open. Line 651, your line is open.
Me.
Please go ahead. We can hear you.
Hi, I'm Kira Gardner from San Diego, and I support SB 793 with no exception.
Thank you.
Line 539, your line is open. Line 539, your line is open.
Central Los Angeles. Hello?
Hello?
Line 312, your line is open.
Hello?
Please go
Please
ahead.
go ahead.
Maria Isabel Rutledge from South Central Los Angeles with Community Coalition and support of SB 793. Thank you so much for this.
Thank you.
Line 632, your line is open.
Huh?
Please go ahead.
Hello?
Yes, please go ahead. We can hear you.
Line 870, your line is open.
Hi, I'm Stella Persinger, and I'm with Maya Prouty. And we are both ninth graders, a part of Napa, California, and we support this bill.
Thank you.
Line 300, your line is open. Line 300, your line is open. Moving on to line number 632, your line is open. Your line is open.
Yes.
Please go ahead.
Hello?
Yes, please go ahead.
Moving on to line number 881, your line is open.
Hi, this is Patty Riddle from San Francisco, and I support this bill.
Thank you.
Line 632, your line is open. Line 632, your line is open. With no response, we'll move on to line number 885. Your line is open.
Hi, I'm calling from TOLA. My name is Ani, and I'm in full support of the SB. I'm sorry, I can't pull it up.
That's okay.
I'm in full support of the SB 793.
Thank you.
And at this time, we have no one else showing support.
Okay, thank you very much. We will go ahead now and move on to opposition. Our first opposition witness is on the phone. I believe it's Jackie Ayers, and she was on the phone earlier. And our second opposition witness will be at RTS LA. So please make that available for testimony here. Each witness will have 3 minutes, and as with our previous witnesses who stuck to that very closely, we'll be asking you to do likewise. So when we find Miss Jackie Ayers, if she's still out there somewhere, we'll allow her to go ahead first. I'm sorry. Just hang on 1 second. We do have someone else in support in the gallery. My apologies. Please go ahead.
Cool. Oh, sorry. Hi. Adrian Mohammed with the California Medical Association in support as a bill, or as is without exemptions. Thank you.
Thank you. Thank you very much. Is there anyone else in the gallery in support? Is there anyone else in our witness room in support? No, there's no one in there. So, okay. So we're back on track. My apologies. Thank you for your patience up there in the gallery. Madam Moderator, if you have Ms. Jackie Ayers on the phone, we'd be happy to take her testimony now.
Ayers, your line is open.
Thank you very much. Good afternoon. Respected committee members, my name is Jackie Ayers, and I'm the owner of Winchester Fuels in Temecula, California. I've been a small business owner for 30 years, 18 at this particular location, and currently employ 9 people. These employees are members of my family, and I take great pride in providing them with good jobs that are focused on effective training, fair compensation, and treating them well. Employing these 9 individuals in this manner allows them to provide for their families and operate as a positive member of their local community. I am also a mom of 4, and I have 6 wonderful grandkids. Let me start by saying thank you for the opportunity to provide public testimony today and for your leadership and commitment to doing what is best for the entire state. However, I am greatly concerned about this proposal to ban the sale of flavored tobacco products, including menthol cigarettes, cigars, and smokeless tobacco. It is crucial to the future of my business that I be here today to advocate on behalf of small businesses like mine who would face significant economic hardship if you move forward with this proposal. As a mother and a grandmother, I agree that youth vaping is an issue that should be addressed, but including menthol cigarettes, cigars, and smokeless tobacco as part of this flavor ban makes no sense. National data shows that youth cigarette smoking has declined to historic lows, including California reporting its lowest high school cigarette smoking rate this past year. Also, cigarette smoking among all age groups has fallen dramatically over the last 15 years. This happened without a policy of prohibition, and that's because regulations meant to prevent underage use can only work if tobacco products are distributed and sold through licensed legal businesses like mine. I require all of my employees to check ID, diligently comply with the higher age requirement. I put health over profit as demonstrated by my perfect tobacco compliance record. I take this responsibility very seriously. In addition, a total tobacco flavor ban won't end the sale of these products in California. It will simply create an illegal market and encourage an increase in criminal activity. I experienced this firsthand recently when criminals broke into my store, not once, but twice in the month of June to steal cigarettes. 88 packs the first time, 44 packs the second time. The only other item they stole was a cup of coffee. Your proposal would only encourage these same criminals to continue to steal, smuggle, and deal illicit products in California at an even higher rate. Now, more than ever, I'm looking to our lawmakers to make the right decisions to help us get back on our feet. I will lock arms with our legislators to limit youth access to tobacco, but this ban is not the right way. Instead of protecting kids, this ban would result, in fact, in a loss of jobs, loss of wages, and represents a potential loss of billions in state tax revenue in the coming years. I implore you to do the right thing and please vote against this proposal. Thank you so much for your attention and your cooperation.
Thank you very much. We'll move to the RTS LA. We have a witness. Please go ahead, Pastor. There's a way to unmute that so we can hear Pastor Toulas. We see him. Hi there.
Thank you.
Okay.
Mr. Chairman and members of the committee. I appreciate the opportunity to speak to each of you under these challenging conditions to express my strong opposition to SB 793. My name is Pastor K.W. Tulis. I'm the president of the Baptist Ministers Conference of Los Angeles and Southern California, the largest ministers conference here in the state of California. I'm joined today by many members of our community from SCLC, Community Forward, all who are here in this Los Angeles location to express our not opposing this bill. This bill fails to see and inherit the institutional discrimination or the institutional racism that exists in our society today. I'm not here today to support smoking. In fact, I don't want nobody to smoke. But I surely don't want kids to smoke. What we have seen here is a clear example of how we can mix kids' agendas with adults' desires. This bill will not prevent smoking at all. This bill will have a negative impact on our communities of color. What we see here is this bill disrespects our community of colors and their preference while it exempts hookah products on behalf of the Middle Eastern cultures. 85% of African Americans choose menthols as their smoking choice. If you put a ban on menthol, it will criminalize this product. It will cause unintended consequences. What do you mean? Have you ever heard of Eric Gardner in New York? Have you ever heard of George Floyd? All of those are unintended consequences. Criminalizing and banning this product will also create an illegal black market for this product. It's easy to understand that because, again, restricting something from our community, it will create sales from individuals in our community, passing it to and from, and we don't need that in our community. Remember this. Remember, it is unjust to expect communities of color to choose between greater public health protections and basic civil rights. Don't restrict something from our community and don't take it from the other community. Don't put a ban on things that our community won't, because, again, at the end of the day, we're not looking for no handouts. We're not looking for no tokens. Of course, we prefer everyone to educate instead of incarcerating. We don't want another war on drugs. We saw what this meant to our community, and we don't want this. I want to yield some of my time to Senator Rod Wright.
Thank you. Actually, the time is up, so it's just a matter of in support or in opposition. So just please state your name and your position on the bill. So we've had six minutes of opposition testimony, so it's just as name and position only, please.
Okay, Roderick Wright, former member of both houses in the Assembly and the Senate, and for the reasons stated by Reverend Tulis, I am opposed to SB 793.
Okay, thank you.
Good afternoon. My name is Olivia Barber. I'm with SCLC, and I oppose this bill.
Thank you.
My name is Sherry Sanders. I'm with SCLC. I oppose this bill.
Thank you.
Hi, my name is Isaiah Nabwaku. I'm with SCLC, and I oppose this bill.
Thank you.
Hi, I'm Thomas Amora-Giver. I'm from SCLC, and I oppose this bill.
Thank you.
Hi, my name is Roshan Sanders. I'm with SCLC, and I oppose this bill.
Thank you.
Gwendolyn Landry. I'm a member of the Southern Christian Leadership Council, as well as the Neighborhood Forward, and I do oppose this bill.
Thank you.
Thank you.
I'm with SCLC, and I oppose this bill.
Thank you.
Hi, my name is Angelica Sanchez. I'm with SCLC, and I oppose this bill.
Thank you.
Hello, my name is Julian Granado, and I'm with SCLC, and I oppose this bill.
Thank you.
Greetings. My name is Jennifer Speck, and I'm with SCLC, and I do oppose this bill. Thank you.
Thank you. Is there anyone else there from at the RTS? Okay, looks like not. So we will go to the phone and ask the moderator to open the phone lines for people in opposition. Once again, just your name and position, please.
Thank you. If you would like to speak in opposition, please press 1 and then 0 at this time. We'll go to line 300.
Are we there?
It'll just be one moment.
My name is Anton Dura.
Thank you.
Thank you. It'll just be one moment for our next one.
As a reminder, just your name, your organization, and your opposition.
And just one more moment here.
I just want to make sure, do we have anybody on the line?
We do have over 50. It'll just be one moment here.
Okay. Are we having technical difficulties? How's it looking?
Thank you for your patience. Line 450, please go ahead.
Hi. My name is Miriam. I'm calling in opposition on behalf of the Arab American Realtors Association, the California Association of Responsible Retailers, and the Neighborhood Business Alliance, which was founded by Arab, Asian, and Black-owned retailers in the Bay Area. Thank you.
Thank you. Next, please.
Thank you. Line 175, please go ahead.
My name is Dan Kelly, representing Cormark International, voicing opposition to SB 793.
Thank you.
Thank you.
Thank you. Line 593, please go ahead.
Hello?
Please go ahead.
Hello? Hello, am I on? Hello?
Yes, please go ahead.
My name is Brian Heacock. I'm with Tuesday Gourmet, a resident of Sacramento. I strongly oppose myself and would like the opportunity to list the 2,729 regular customers of mine who also.
Okay, thank you.
Thank you. Line 409, please go ahead. Line 409. We'll move on to line 150. Please go ahead.
Good evening, Mr. Chairman and members. James Lombardo Sr. on behalf of American Petroleum and Convenience Store Association. We are minority-owned businesses generating $1 million per store in taxes for cities, counties, and California. We are opposed to SB 793. Thank you.
Thank you.
Line 197, please go ahead.
Hello, this is Kewal Krishan from EPCA. I oppose 793, please.
Thank you.
Line 605, please go ahead.
Good evening, Chair and members. Neil Clark on behalf of the California Distributors Association, respectfully opposed to the bill.
Thank you.
Line 47, please go ahead.
Hello, my name is Victoria Drower, and I work at a small vapor retailer called Desert Vapors from the Coachella Valley. As a member of the Vapor Technology Association and on behalf of the owner of Desert Vapors, Russ Meltzer, I strongly oppose SB 793.
Thank you.
Line 789, please. Line 789, please go ahead.
Hi, my name is Samuel Nieto, and I'm with the Latino Educational Fund in Los Angeles, and we strongly oppose SB 793. Hookah contains tobacco.
Thank you.
And it's
Thank you.
Thank you. Line 727, please go ahead. Line 27, please go ahead. We'll move on to line 648. Please go ahead.
Yes, I'm Pastor William D. Smart Jr., President and CEO of the Southern Christian Leadership Conference of Southern California. We strongly oppose SB 793.
Thank you.
Line 601, please go ahead.
Yes, my name is Amal Shaheen, and I'd like to speak on behalf of the 12,000 convenience store retailers in the state of California, and we all strongly oppose SB 793.
Thank you.
Line 258, please go ahead.
Hello, Desiree Vicente with Casa de la Cultura Maya, opposing SB 793.
Line 410, please go ahead.
Yes, good afternoon. My name is Corey Pegues. I'm a retired executive from the New York City Police Department, and I'm calling as a member of LEAP, Law Enforcement Action Partnership, and we strongly, strongly oppose SB 793.
Okay, thank you.
Line 759, please go ahead. Line 759, please go ahead. Line 200, please go ahead.
Hello.
Please go ahead.
Line 484, please go ahead.
Hi, Tom Robinson with Rotten Robbie Stores, and we oppose 793. Thank you.
Thank you.
Line 437, please go ahead. Line 437, please go ahead. Move on to line 662, please go ahead.
Hello, my name is Danielle Jones, calling on behalf of the Consumer Advocates for Smoke-Free Alternatives Association in strong opposition of this bill because harm reduction saves lives.
Thank you.
Line 121, please go ahead.
Yeah, you were watching, but we've been waiting on the phone since...
Line 121, please go ahead.
Hi, my name is Isis Dominguez. I run multiple stores in Santa Barbara. I am an ex-smoker who's been smoke-free for 5 years through the use of non-tobacco flavored vape products. I strongly oppose SB-79.
Thank you.
Line 657, please go ahead.
Good evening, Mr. Chairman. My name is Miguel Gonzalez, and as a proud father of two, I strongly oppose SB 793.
Thank you.
589, please go ahead. Line 589, please go ahead. We'll move on to line 464, please go ahead.
Hi, good evening. This is Hector Fernandez on behalf of Swisher International in opposition to SB 793. Thank you.
Thank you.
Line 587, please go ahead.
Hi. Hello?
Yes, please go ahead.
Please go ahead.
My name is Gracia Barragan. I'm with the Hispanic Small Business Association and the Minorities Making a Difference. This is a racist and terrible, terrible bill.
Thank you.
I oppose.
Thank you.
Line 482, please go ahead. Line 482, please go ahead.
Valerie Nera for the California Chamber of Commerce. We're in opposition to SB 793. Thank you.
Thank you.
Line 699, please go ahead.
Hello.
Yes, please go ahead.
Good afternoon, Julie Oberwager from San Diego on behalf of Communities for Safer Vaping in strong opposition of SB 793. Thank you.
Thank you.
Line 604, please go ahead.
Good evening. This is Erin Norwood on behalf of Swedish Match North America. We have an opposed unless amended position on the bill asking for the exemption of our 8 smokeless tobacco products that have both a PMTA and MRTP designation from the FDA, as well as our nicotine-only products within. Thank you.
Line 116, please go ahead.
Good afternoon. Oscar Romero out of Desert Vapors. I oppose this bill.
Thank you.
Line 133, please go ahead.
Hello, can you hear me? Great. This is Norris from Goleta, California, small business owner. On behalf of several retailers in the Central Coast and over 3 million ex-smokers of voting age, we strongly oppose SB 793. It will lose the state tens of thousands of jobs.
Line 802, go ahead.
Hi, my name is Chris Messick. I'm a father of 3. I ask you to protect my rights and oppose this bill. Thank you.
Thank you.
Line 581, please go ahead.
Yeah, hi, my name is Deanna. I'm actually a mother of 2 teenage boys. I'm an active advocate for harm reduction, and I strongly oppose SB 793. Thank you.
Thank you.
Line 270, please go ahead. Line 270, please go ahead.
Hi, my name is Rami Issa, and I strongly oppose the bill. Representative Carr, California Association of Responsible Retailers. Thank you.
Thank you.
Line 555, please go ahead.
Hi, my name is Shannon Cousins. I am a member of Communities for Safer Vaping, a chapter of the association, and I strongly oppose SB 793. Thank you.
Thank you.
Line 454, please go ahead.
Good afternoon, Chair and members. My name is Diane Goldstein. I'm the board chair of Law Enforcement Action Partnership, as well as a retired lieutenant from Redondo Beach Police Department, and we strongly oppose.
Thank you.
Line 145, please go ahead.
Hello, my name is John Dixon. I'm a former chief of police, past president of the National Organization of Black Law Enforcement Executives, and I'm speaking on behalf of Law Enforcement Action Partnership, and we vigorously oppose this bill.
Thank you.
Line 596, please go ahead. Line 596, please go ahead. Line 925, please go ahead.
Sodi Shoker, owner of a small convenience store, and I strongly oppose SB 793.
Thank you.
Line 217, please go ahead. Line 217, please go ahead.
Yes, hello. This is Lizette Van Vliet from Breast Cancer Prevention Partners. I'm actually here in support of the bill, but I didn't get a chance to speak beforehand. We're strongly in support of the bill as is.
Thank you.
Line 229, please go ahead.
Oppose 793 SB.
Okay.
Jasmine Dillon.
Okay. Thank you.
Thank you.
Line 777, please go ahead.
Hi, my name is Samantha Ryan, and I work for Aspire Vape Company, and I strongly oppose.
Okay, thank you.
Thank you. Line 483, please go ahead. Line 483, please go ahead.
Next, open line number 876. Your line is open.
Tahoe resident of Placerville, California, and I oppose SB 793.
Thank you.
Line 831, your line is open.
My name is Anton Dura from APCA, and I oppose this bill.
Thank you.
Line 901, your line is open. Line 901, your line is open. With no response, we'll move on to line number 178. Your line is open.
Hello, Chairman. Can you hear me, please?
Yes.
Yes, thank you, Chairman and members. My name is Daljeet Baines. We're a convenience store franchisee in Placer County, and we oppose SB 793. And the irony of this bill is that we are actually the...
Thank you. Thank you. Just your name and your organization, please.
Thank you. Line 261, your line is open. Line 261, your line is open.
This is Jiptash Gill representing EPCA and its California Essential Markets in opposition of 793. Thanks.
Thank you.
Line 640, your line is open.
Hello, my name is Robert Dietz. I'm a business owner in El Dorado County, father of a high school senior, and registered certified coach for NorCal mountain bike high school team, trap shooting team, and Boy Scouts, and I am opposed to this bill.
Thank you.
Line 550, your line is open. Line 550, your line is open. With no response, we'll move on to line number 935. Your line is open.
Hi, can you hear me?
Line 935, your line is open. Thank you.
My name is Matthew Jenkins, father of three, and I'm in opposition of this bill.
Thank you.
Line 597, your line is open.
I'm Christopher Harchin, owner of the Vapor Trail, Ramona, California, father of one. I strongly oppose this bill.
Thank you.
Line 600, your line is open.
Hello, Chair and members. My name is Jay Oku. I'm a proud parent of two children, calling from the County of Orange on behalf of Five Ponds and the over 2 million smokers that are going to be forced to the black market with a discriminatory bill. I vehemently oppose SB 793.
Thank you. Just your name
Line
and position,
598.
please.
Line 598, your line is open.
Yes, hello. My name is Lam Nguyen. I'm from San Jose, California. I'm an adult over 21 and a U.S. Army veteran. I strongly oppose SB 793. Thank you.
Thank you.
Line number 910, your line is open.
Yes, this is Roy Sunford Market and Liquor on behalf of Chula Vista Stores. We oppose the SB 793.
Thank you.
Line 915, your line is open.
Hi, my name is Pavinder Singh, and I strongly oppose Bill 793.
Thank you.
Line 921, your line is open.
Hi, Sanjeev Patel from National Petroleum, and I strongly oppose this bill on behalf of 1,500 members of American Petroleum and Convenience Store Association.
Okay, thank you.
Line 912, your line is open.
Hello, my name is Raheel Ramzan. I'm an ex-smoker and I oppose this bill, SB 793.
Thank you.
I was like, got on 200.
Line 411, your line is open.
Hi, my name is Amanda Elliott of Santa Cruz County. I'm a former smoker of 27 years that quit with these far less harmful products, and I am opposed to youth vaping, but I'm far more opposed.
Thank you.
Line 821, your line is open.
My name is Markia Dale. I'm representing Circle K convenience stores across the state of California, and we strongly oppose SB 793.
Thank you.
Line 540, your line is open.
Hello.
Please go ahead.
Hi, good afternoon, chair members. My name is Alex Hansen. I'm an ex-cigarette smoker of over 10 years. I do strongly oppose the SB 793, and I do propose that you reinforce the minor in possession prosecution.
Thank you.
Thank you.
Line 880, your line is open.
My name is Rosalind Renfro from Los Angeles Black Pride. We strongly oppose the SB 793. Please.
Thank you.
Line 727, your line is open. Line 727, your line is open. With no response, we'll move on to line number 181. Your line is open.
Hello. Hi, my name is Christine Greer. I'm calling on behalf of the California Association for Responsible Retailers, and we oppose Bill 793. Thank you.
Okay, thank you.
Line 965, your line is open. Line 965, your line is open. Moving on to line number 923, your line is open.
Yes, hello. My name is Fuad Karoum, father of two. On behalf of DNA Enterprises, I object SB 793 very strongly.
Okay, thank you.
Line 887, your line is open.
Hello?
Yes, please go ahead.
Hi, this is D. Caldwell with DNR Petroleum. I also oppose SB 793. Thank you very much.
Thank you.
Line 936, your line is open.
Hello?
Yes, please go ahead.
Hi, this is Vanessa James, located in San Diego, and I strongly oppose SB 793.
Okay, thank you.
Line 924, your line is open.
Hi, this is Mateen Sharifenajad, 7-Eleven franchisee in Orange County, California. Strongly oppose this bill. Thank you.
Thank you.
Line 849, your line is open.
Good afternoon. My name is Hrant Ayvazian, father of two. I work for Aspire Vape Distribution Company. I strongly oppose SB 793.
Thank you.
Line 938, your line is open.
Hello, this is Paul Singh. I'm an attorney and a business owner and proud parent of four, and I strongly oppose this bill.
Thank you.
Line 364, your line is open. Your line is open. With no response, we'll move on to line number 973. Your line is open.
Thank you very much. My name is Richard Abel, and I represent 54 Fast Trip stores based out of Bakersfield, California, and I oppose Senate Bill 793. Thank you.
Thank you.
Line 262, your line is open.
Good afternoon.
Good afternoon. Please go ahead.
This is Bill Stein with Cormark International, representing its thousands of employees, and we strongly oppose SB 793.
Thank you.
Line 976, your line is open.
My name is Ray Abdullah and manage 4 stores in San Diego County opposing SB 793.
Thank you.
Line 538, your line is open. Line 538, your line is open.
Hello?
Please go ahead.
Hi,
Hi, my name is Ryan McCoy. I'm with Cormark International, representing our 403 employees, and we oppose SB 793.
Okay, thank you.
Line 200, your line is open.
Yes, hi. Can you hear me?
Yes, sir. Please go ahead.
Hey, good afternoon. My name is Ryan Durkin, representing Cormark International, located in Hayward, California, and I'm calling to oppose SB 793.
Okay, thank you.
Line 219, your line is open.
Hi, good afternoon. My name is Sukhi Sandhu. On behalf of the Central Valley chapter members of APCA, American Petroleum and Convenience Store Association, and the Central Valley 7-Eleven Franchise Owners Association, strongly oppose the bill SB 793. Thank you.
Thank you.
Line 8 to 39, your line is open.
Hello.
Please go ahead.
Can I go ahead?
Yes, please.
Okay.
Go ahead.
Which number is mine, sir?
I'm sorry?
Please go ahead,
Hello?
sir.
Which line number is mine?
Well, you're in the
Are you
opposition
opposing,
line.
sir?
Yes. I am opposing. I am calling from the Orangeville Smoke Shop.
Okay, great. Thank you.
Line 905, your line is open.
Yes, I am calling from the Orangeville Smoke Shop. My name is Ashok Desai. I am opposing the bill.
Okay, thank you.
Line 124, your line is open.
Hello?
Hello?
Hello? Please go ahead.
Hi. Can you hear me?
Go ahead. Can hear you.
Hello?
Yes.
Hi, my name is Namni Nguyen with Stay Vape, and I strongly oppose SB 793.
Okay, thank you.
Line 409, your line is open.
Hello?
Yes, please go ahead.
Hello, this is Keval Sachdev, small business owner in San Jose. I strongly oppose SB 793.
Okay.
Thank you.
Thank you.
Line 375, your line is open.
Yeah, Mr. Chair, members, John Winger on behalf of the California Fuels and Convenience Alliance, opposed. Thanks.
Thank you.
Line 841, your line is open. Line 841, your line is open. With no response, we'll move on to line number 989. Your line is open. Line 989, your line is open.
Ay, ahí está, pegado el Morton.
Hi, line 991, your line is open.
Hi, this is Eddie. I'm Spanish minor owner. I've been doing this for 9 years. I oppose this to save my life, my community as well.
Okay, thank you.
Line 951, your line is open.
Yes, my name is Harold Hochberg with Cigar Box, and we do pipe tobacco as well. I oppose this SB 793.
Okay.
Thank you.
Thank you.
Line 933, your line is open.
Hello?
Yes, please go ahead.
Yes, my name is Yazan Mohamed. I am a business owner, and I oppose SB 793.
Okay, thank you.
Line 764, your line is open.
Hi, my name is Sarah Martel from Oakley, California, and I oppose the bill.
Thank you.
Line 560, your line is open. Line 560, your line is open.
My name is Vigavasi.
Hey there, can you hear me?
Thank you.
Hello?
Yeah. Please go ahead.
Hello, anyone there?
Yeah, we're here.
Hey there, my name is Pri Davda on behalf of Davda Inc., Valley Circle Chevron in Woodland Hills, California, and also on behalf of Chevron convenience store retailers throughout California. Strongly oppose SB 739.
Okay, thank you.
Sorry, SB 793.
Okay.
Thank you.
Thank you.
Line number 983, your line is open.
Hi, my name is Gnor Singh from Sacramento, California, and I am a small business owner, and I oppose Bill SB 793.
Thank you. Thank you.
Line 229, your line is open.
Hello?
Yes, please go ahead.
Oh, did you hear me?
Yes, we can hear you. Please go
Can you
ahead.
hear me?
Yes.
Oh, I'm sorry. I'm actually passionately for the bill, but
Oh.
I couldn't get through.
Okay.
So my name's Diane
That's
Moore.
okay.
I'm a
we'll
mother
take
of
your-
5. I'm a mother.
So-
Line 997, your line is open.
Hi, my name is Archana Danielian. I work for Aspire School, and I strongly oppose SB 793. Thank you.
Thank you.
Thank you.
Line 875, your line is open.
Hello, my name is Jack Greer. I'm with California Association of Responsible Retail. I am a father of one, and I vehemently oppose Senate Bill 793.
Okay.
Thank you.
Thank you.
Line 975, your line is open.
Yes, my name is Jesse Singh. I'm a father of 3, and I strongly oppose this bill, SB 793.
Okay, thank you.
Line 998, your line is open.
Hello?
Yes,
Hello?
please go ahead.
This is Senator Yes, Wright. this How are is you today? Hello? I understand someone had a question for me. Yes, hello?
Yes.
Hello? Yes, this is Senator Wright. I'm calling back. Someone had a question for me.
Not that I'm aware of, sir. No one's asked any questions at this point. We're just taking people opposed to the bill. So,
Okay, yeah, this was Mr. Heath.
Mr. Wright, can you wait a moment, sir? We're actually doing opposition for a bill.
Okay, and that is what I was involved with. Is it a 793?
we are taking people in opposition to this bill. We're not, that's what we're doing right now. So, I'm not aware of anybody
Okay,
asking any questions.
Okay, well, somebody was supposed to ask me. All right, I'll hold on.
Okay.
Okay.
Thank you. Madam Moderator?
Thank you, and we'll move on to line number 592. Your line is open.
Hi, this is Christine from San Diego, and I oppose SB 793.
Thank you.
Line 893, your line is open.
Hello, my name is Andy Perkins, and on behalf of Cormark International, my 200 employees, and my 1,400 retailers, I strongly oppose SB 793.
Thank you.
Line 1020, your line is open.
Hi, my name is Adam Swanson. On behalf of Coastal Clouds LLC and all of my customers, we strongly oppose Bill SB 793.
Thank you.
Okay, Rod Wright, I was
Line 1023, your line is open.
calling back. I'm on the...
Hello, my name is Terry Lai. I'm a 55 years old resident of Irvine. I strongly oppose this racist bill. Thank you.
Thank you.
One moment, please. Next, we'll go to line number 999. Your line is open.
Hello.
I'd be him. I'm calling you back, sir.
Hello.
Please go ahead, ma'am.
My name is Paula Baltayan. I am a smoke shop employee, and I oppose SB 793.
Thank you.
Line number 989, your line is open.
Okay, hold on a second. And you've got a copy yourself.
Please go ahead, ma'am. Line 989, your line is open. $9.89, your line is still open. Please go ahead. Okay, we'll move on to line number 905. Your line is open.
Hello?
Hello? Hello?
Yes, please go ahead.
Hello, I'm Sarah Ali, and I oppose SB 793. Thank you.
Okay, thank you.
Line 1029, your line is open.
Hello, my name is Kal Al-Mughrabi, business owner from Riverside County. I strongly oppose SB 793. Please help us not destroy business in California.
Thank you.
Line 1030, your line is open.
Hello?
Yes, please go ahead.
Yes, my name is Umang Shah. I'm a resident of Pasadena, and I strongly oppose SB 793.
Okay, thank you.
Line 1028, your line is open. Hello?
Yep, please go ahead.
My name is Jake Perlingos of Valley vs. Everybody. I strongly oppose SB 793, and I implore you to listen to your voters.
Thank you. Thank you.
Line 976, your line is open. (976), your line is open. Line 1035, your line is open.
Hello?
Yes, please go ahead.
Hello? Yes, my name is Chris Leva, and I'm with Right Base Incorporated, and I strongly oppose SB 793.
Okay, thank you. Madam Moderator, we're going to take 10 more, and then we're going to close the opposition testimony. So 10 more calls, please. And we'll keep track.
Thank you, sir. Okay. Line 1040, your line is open.
Hello?
Yes, please go ahead.
Hello?
Yes, please go ahead.
Yes, hi. My name is Dalbir Chahal. I'm speaking on the behalf of APCA, and I'm also a retailer in Sacramento County. I strongly oppose this bill.
Okay, thank you.
Line 1040, your line is open. Excuse me, 1041, I apologize, your line is open. (1041), your line is open.
Hello?
Yes, please go ahead.
Hello?
Yes, please go ahead.
Yes, I want to address the chairman and members that our voice is not being heard equally.
Thank you. Are you an
because
thank
we're
you.
being on the last
Thank
the
you.
opposition.
Thank you. Just your name and
Line
position,
1040.
please.
Thank you, sir. 1044, your line is open.
Hi, my name is Diane Greer, calling on behalf of California Association of Responsible Retailers. I oppose SB 793. I implore you to stick with your constituents.
Thank you.
Line 1051, please provide your name and affiliation.
Hello, my name is Rami Hatoum. I'm calling on behalf of 16 employees that work for me, and they're all going to go jobless with you doing the 793.
Okay.
I oppose it strongly. Thank you.
So 5 more calls.
Line 1050, please provide your name and affiliation. Line 1050, please go ahead. Line 1050.
Hi, my name is D. Awasti, and I'm a retailer here in San Jose, and I very strongly oppose this bill, SB 793. Thank you.
Thank you.
Line 1047, please provide your name and affiliation.
Yes, my name is Jesse, and I am a small business owner in Sacramento. Strongly oppose this bill, SB 793.
Thank you.
Line 592, your name and affiliation. Line 592, your line is open, please.
Hello?
Please go ahead.
Hi, this is Mike D. I vape, I vote, and I oppose 793.
Great, thank you.
Line 361, your line is open.
Yes, sir. My name is Pravinder. I'm calling from County Sacramento. I will oppose SB 793.
Great, thank you. And the last
Thank
call.
you.
Last call, please.
Line 1054, your line is open.
Teaches you everyday practical conversations that you will actually use in 15 minutes a day.
Line 1054, your line is open. Name and affiliation, please.
This is a modern conversation-based technique that makes language engaging, fun, and
We have no response from line 1054. Should we try one more, or was that it, sir?
I think that's it, thank you. I'll just make an
Thank you.
announcement that any other witnesses in opposition that were not accommodated today are welcome to submit letters to the Assembly Health Committee portal. I believe there was one person who had been on the line for a very long time waiting to testify in support, and we could just get their name. I believe it was from Autumn Ogden. If she's still on the line, if we could open that, and then I know we have a couple people here in the chamber as well. So if Autumn Ogden is out there, please press 10. And if not, we'll go to, we'll just end it there. We have two people in the chamber, please. Please go ahead.
Good evening. Thank you for your time. My name is Christopher Van Buskirk. I'm here on behalf of the California Association of Retail Tobacconists and its California members. We oppose SB 793 for the following reasons.
Thank
One,
you. Excuse me. Thank you. Just your name and organization. That's.
Can I have just 30
Nope.
seconds?
Nope. Thank you. Anybody else? Mr. Sargent, is that it? One more? That's it. Okay, I'm sorry. Thank you. All right. Okay, before we bring back the committee, before I ask committee members to make comments, I'm going to ask Senator Hill. I do have a couple of committee amendments I'd like to ask you to take. So I'm going to ask you to take two amendments. First of all, I'm going to ask you, this will be called Subdivision 5. The exemptions shall not apply to the sale of premium cigars sold in cigar lounges where products are purchased and consumed only on the premises. And then Section 6, the subdivision shall not apply to loose leaf tobacco. Are you willing to accept those amendments, Senator Hill?
Mr. Chair, I am willing to accept, but would appreciate the opportunity because of the intent, and we just saw these and just heard them, to have conversations in the drafting of those amendments to make sure that the intent is clear in that, if we could have that opportunity. But I accept the amendments as your approach.
You accept the amendments. That's the important part. Okay. All right. Fair enough. Okay. All right.
Thank you.
Thank you. At this point, we will ask members for comments and questions of the author.
Thank you, Chair. I just, I want to highlight, and I appreciate that this is issue that's been extremely engaging for our state, and I know for the legislature as well. And I want to reflect that over the last decade, this has been an issue that has been brought forward. I'm a former school board member, and when e-cigarettes and vaping first came out, school districts had no idea what to do. We didn't know what they were. We didn't even know what category. I remember the California School Boards Association had to try with legal counsel to determine whether it was covered under tobacco or not. And so I think we've had 10 years of a lot of experience in our state and around the country on why flavored tobacco is a harm to our students and why it's become a gateway. So I appreciate that the author has brought this forward. I know that this has been difficult. It's been years in the making, but I do want to recognize that the policy discussions around this and the connection to tobacco use amongst minors are very real. And in so many local communities, it's been well over a decade that we've been grappling with what to do about this. I think with COVID, there's no doubt that respiratory problems are a big issue, and you think about those elements that don't help respiratory problems, and you know that this is one of them. So, I'm a co-author of the bill, I'm supporting the bill. I do appreciate the engagement around the state on this particular issue, but I think it's really important to recognize that this is been in the making, and policymakers at the local, regional, and state and national level have been trying to tackle this. And I think we know a lot about the impacts it has on minors and how this serves as a gateway for prolonged use and also health impacts that are very real in a lot of communities right now. So thank you.
Thank you. Thank you, Member Limon. I honestly can't remember who was next, so go ahead, Mr. Rodriguez.
Thank you, Chair and Senator. Thank you for bringing this very important discussion forward as we talk about these vaping products, and I think the flavors that are out there that are really attractive to the children and our youth of the state. I'm looking at this bill and seeing that there were some proposed amendments that you're willing to take. Just unfortunately, I wish I would have had them a lot sooner rather than as the 11th hour, so to speak, that we're looking at kind of getting a better understanding what these amendments mean and how does it look in reality to the bill. I'm glad you are working on some of these and looking to accept them as being presented, but I still having some issues to grasp around it. I'm torn about this bill. It's an important bill. It's something that's really desperately needed and to address, but I just have two comments I wanted to make about this bill. One is the lost revenue that's being talked about in the staff analysis of about $200 million. What do we look to do because of that lost revenue to our budget? We look at a state budget of over $50 billion in lost revenue or in dilemma that we're going to be. How does that look to our current budget for the next year moving forward and funding some of these services and programs that are benefited from the sale of some of these products? The second one I was thinking of as we're talking about the bill is the enforcement of it. Who do we look to enforce that these products are not being sold in our communities? We looked at cities and counties' budgets that are stretched thin already. When COVID upon us, the funding is very limited, so I don't know how we would look to enforce it. So I just have those two comments, and I'm leaning to maybe support this bill. If I do, it would be as a courteous vote because of these amendments, but as I grasp myself around these amendments that are being proposed, I would reserve my right, if I support it now, to support it if it gets to the floor. So if you can just kind of piggyback on the two questions, I appreciate it.
Sure, thank you, Assemblymember. And really the cost of the lost income, as we want to say, I think has been overshadowed by what is the reality. When you look at the health care costs that California will save, as I mentioned in my opening statements, that there are, especially the Medi-Cal costs, the savings of $3.58 billion per year with this legislation and with this bill passed. So there'd be a tremendous savings of health care costs besides the $13 billion in normal health care costs through health insurance that will be saved and preserved too, which should reduce the health premiums that most of us pay for our health insurance. So in total, this will be a greater savings than it will be a revenue loss. And frankly, to even look at it as a revenue loss, there's no price you can place on the life of a child or a kid or teen or in someone's life later on. So in total, it'll be a cost savings. So thank you.
Before we move to the next member, I just want to clarify something. It's my error, and I apologize. It's been a long testimony already, and we still have many bills ahead of us. So I do want to clarify, there are actually three pieces to the amendment. Number one, we're exempting essentially a premium cigar. We're defining that as any cigar that is not mass produced by use of mechanization and has a wrapper that is made entirely from whole tobacco and has a wholesale price of no less than $12. Then it is, the subdivision shall not apply to the sale of premium cigars sold in lounges where products are purchased and consumed on the premises. And then the third piece of this is it shall not apply to loose leaf tobacco, which is meant to encompass pipes and also people who might be using this for ceremonies in Native American Indian ceremonies. So that is the context in which these are presented. So I apologize that I didn't make that clear.
I do have a copy of it, so thank you.
Understand that, so thank you. So I'm trying to think who was, I think Mr. Ramos was next, then Mr. McCarty and Ms. Burke. We're just kind of going around here. I'm not ignoring you, Mr. Flora.
Well, thank you, Mr. Chair, for this opportunity, and thank you for introducing this much needed bill. There is areas that I still have concerns, and that's the funding mechanism of it. Certainly you brought up the good work that First Five has done to educate the community on the problems with tobacco, but yet we don't have that revenue stream for education on the vaping products of it. And we've talked at length on that component of it. So I wanted to, as this dialogue continues to move forward, that it's clear that there has to be some type of discussion on the funding stream for the vaping products so that we could actually get the funding into the local level to be able to educate a lot of the communities that need that education on the vaping product itself. We've talked at length again on where we start at the vaping. I agree there needs to be some type of banning on those products, but also the educational component to follow the same revenue mechanism as First Five. We've talked at length on that. And also talking about tobacco and the ills that are there now that we're into that, but we also just seen that recreational marijuana was approved. So I think that being able to forward think through these topics, that we could be hit with that educational process on that aspect also. And I get to where my colleague from Pomona brought up as far as the enforcement mechanism. Certainly if we're gonna ban something, who's gonna have the resources to enforce that ban? Is it local law enforcement, or who are we gonna ask to bring that forward? And I bring that up, not so much to, just more to talk about the probability of who's enforcing it, because we've seen what has happened with illegal marijuanas and dispensaries that are out there, and now we're trying to close those down to get the revenue into the local jurisdictions. So these are issues that are very real, and these are issues that still are very concerning to me, especially when we start to talk about vaping, and then we go into the tobacco and some of these other areas. But yet, we have to be able to look at where that enforcement's gonna come from. These are things that I wanted to bring up and make sure that we're on record talking about these reasons and the funding stream that I believe should be part of a discussion moving forward should this bill continue to be debated and these issues along the way. Thank you, Mr. Chair, and thank you, Senator.
Thank you.
Thank you, Mr. Ramos. Ms. Burke, yeah, and then Mr. McCarty.
Me?
Please
Thank
go ahead,
you.
Ms. Burke.
Thank you, Mr. Chair. And first, I'd like to thank the senator for being so gracious when we spoke about this bill. We haven't always agreed, but I believe we've always had a very good working relationship, and I have a ton of respect for the senator and his work.
Can you speak up just a
yeah,
little?
for
Thanks.
the senator and his work. So I just want to make sure before I say what I'm getting ready to say that that is clear.
Thank you.
However, there's a however. You know, I think most of us agree here that we don't want to see kids smoking. In fact, if I had it my way, no one would smoke. I'm not a fan at all. That said, deciding how to vote today has been a real challenge for me. And I want to be super clear about the crux of my annoyance is that the bill is indicative of a trend that I find belittling and counterproductive to the wider goals of inclusivity, empowerment, and enrichment that our state continually preaches. Smoking addiction, much like alcohol dependency, is usually a symptom of a much larger problem. These products have become vices used to escape reality. Take a drive through a portion of my district, and you would be hard-pressed to find a liquor store. Drive through the other side, and you'll be hard-pressed to find a grocery store or a hospital, yet there is a liquor store or convenience store on every corner. And people want to talk to me about communities being targeted. Over and over in the bills we've passed, I see symptoms of our state's problems being addressed, and we casually gloss over the underlying causes of those problems, and this bill is no different. According to the CDC, adults below the poverty level are more than twice as likely to smoke as adults who are above the poverty level in annual income. That gap jumps 3 times more likely when we compare adults with less than a high school education to adults with college graduation. It's not coincidental. We know there is a direct correlation between poverty and things like smoking and drinking that help people, and these are things that help people cope with the stress and trauma of poverty. Since this bill has made it over to this House, I've dealt with more calls, more meetings, more texts, sometimes around the clock, not to mention social media ads trying to push me, in my opinion, in one direction or another. And it begs the question, where is this fury on activities around bills that tackle real poverty and homelessness issues, or to protect kids, or when it comes to protecting the liberties of Black and brown people? I'm not sure I see help here. I see folks banging a drum that claim to protect Black and brown people, but once again, criminalizing their choices when we should be creating opportunities and incentivizing better choices. Even more confusing is that while we sit here and acknowledge that any tobacco use is harmful, this bill contains a carve-out for a certain type of product for no scientific-based reason. The proponents say that you want to help minorities from detrimental health impacts that arise from tobacco use, only then to include language that implies one group of minorities is more responsible than another to indulge in those products. My struggle leading up to this hearing has been based in these kind of frustrations. And I certainly hope that moving forward that I can see the same enthusiasm and commitment to lifting Black and brown people up, not just parading us out whenever those see it fit. However I decide to vote today, I have to be honest, it's not a win for me. I will be disappointed in whatever I end up voting today. But I thank you for the hard work, Senator. I thank you for the hard work, Mr. Chair, and to all the committee members who've spent countless time talking to me about this issue. I appreciate your support and conversation as well.
Thank you, Ms. Burke. Mr. McCarty.
Thank you, Mr. Chair, and thanks, Senator Hill, for pushing this for the last few years. This is an issue that is being heard up and down our state. There are over 100 jurisdictions, I believe, that have taken some sort of policy at the local government on flavored tobacco and or vaping, and the time is right. This is an absolute epidemic through our country. Before COVID-19 hit, this was the public health epidemic and the issue of the day on the New York Times Daily and Frontline as far as what's happening across our country. In urban neighborhoods, in middle America, in schools up and down our state of California. The bathrooms in our local middle school here at Cal Middle School in Sutter, the local parents were saying they're the jewel rooms where kids were going and on their breaks having an opportunity to engage with flavored tobacco. I saw a parent one time, and they had this little hoodie, and the little string on the hoodie was a flavored tobacco device, and they were in the classroom. And so, certainly these things can be non-flavored, and that's a reality, but let's face it, the hook is for our youth, for these flavors that are just romanticizing what's cool. I'll never forget. Last year, I took our little girls to sell Girl Scouts up here at Safeway. They're 10 years old. And when my little daughter Victoria said, "Daddy, that cigarette smelled so good. What was it?" Someone walked out with vaping. She's like, "It smelled so good. It was cinnamon and something else. It tasted good. It smelled so good." A 10-year-old. And I hope to God my kids never get addicted to tobacco, because we know tobacco companies have one mission: to make billions of dollars for their companies and their shareholders. And they have one byproduct, and that's killing people. There's no good that comes out of this product. The health costs are tremendous. And we'll get to that in a second, because I want to focus on that. But look, this isn't that complicated. This is bipartisan. In the Senate, this same bill, the stronger bill, had 4 Republican senators vote for this bill. So I hope that this House does the same, because it's not that complicated. And your constituents back home, the ones who care about this, are talking about how this matters. Certainly there are a few businesses that are going to lose money and profits for this, but we're more about saving lives in California than helping a few businesses thrive selling tobacco products. This issue, too, is, I think, very important during COVID-19, because let's face it, the people who are facing problems from vaping have impacted immune systems. And there's, especially the younger people, I would say there's probably a big connection with people who have vaping addiction, and that frankly have are more likely to and more likely to be at risk for COVID-19. I want to address the issue of the finances for this. And let's face it, we are the Health Committee. We're not the Appropriations Committee. We're not the Budget Committee. So our hat today is to look at the health lens. Does flavored tobacco hurt or help the health of Californians and our kids? I think that's the lens we should be looking at right now. And it's true. I said this to one of my colleagues last night. I don't want to flippantly just dismiss $200 million, because that's money. But a $200 billion budget, $200 million in this, the most of the tobacco tax money is one time, right? The incoming money to first 5 bodies across California, these first 5 bodies who support this bill have said they will gladly go out of business tomorrow. They use their money that comes in for these revenues for first 5 to fund things like early education and healthcare, focusing on kids 0 through 5. They know it's a declining revenue source. They don't use any of their money to fund ongoing things. There's not money to fund our public school system, not money for K-12, not money for early education, because it's all one time and it's declining. Granted, last year we have now a tax on vaping products that hasn't phased in yet, so actually this is a great time to do this, because there's not going to be a loss for something that hasn't really went into full effect yet. So as far as the impact for our public schools, for our youth, it's minimal. And as Senator Hill said, the savings are 10 to 20 times greater as far as what you would save without having to pay these tremendous costs to our healthcare system and Medi-Cal. So this is right for so many reasons. I would have preferred the other version, but this is a deliberative legislative body, and I fully respect our chair and our senator, working on this. Assemblymember Wood and I had the same bill last year. This year we decided to go with one bill, so this is the bill here before us today. So I'm certainly proud to be a joint author. And I want to address this whole criminalization of issues, because I think it's it's a fallacy to say that we're going to be arresting people for using these products, for smoking a menthol cigarette. We're saying that no longer can people sell the product, but we're not going to be arresting people for possession. We're not going to be increasing penalties for any of that. But I do think that there is something wrong in our system. If you have a liquor store and you illegally sell booze to a minor, you get popped once or twice, you lose your liquor license and has severe consequences. But if you're a convenience store and you have multiple infractions of selling for minors, there's not that consequence. So there's another bill, another day. I think that we need to go and address that because I think we need to have some parity on that because there is no disincentive for inappropriate behavior. But in sum, the time is right for us to do this in California. Again, we're the Health Committee, and I'm in full support of this measure, and I would like to make a motion on this bill, Mr. Chair.
Thank you, Mr. McCarty. Ms. Carrillo.
Thank you, Mr. Chair. Permission to read?
Of course.
Thank you. I just want to read a little bit on the fiscal impact from the committee analysis that states that the estimated tax revenue loss of this bill is $110 million this fiscal year, $85 million from cigarettes, $2 million from tobacco products, and $218 million for next year's fiscal year, the first entire fiscal year that the ban will be in effect. In addition, associated sales tax losses of $26.6 million, $12 million to the general fund, and so on. So all of that is available for all of us to be able to digest. I bring that up because this bill has been moved and brought to this House for us to vote on. And it is incredibly important. I don't think there is anyone in this floor right now or in both houses that disagree with the crisis on youth vaping. Everyone wants to see that move forward. I have not spoken to any one member in either house and in either party or one party that disagrees with that. But this idea that only because this is a policy committee during a global pandemic that we will not think about the fiscal impact just seems a little unorthodox and a little narrow-minded. Next year, we will be faced with massive revenue losses. We will be asked to make decisions on things to cut. I think that my colleagues that have expressed those concerns are already thinking about that. So next year, when we're looking at the budget, we're going to have to think, okay, do we cut funds from childcare? Do we cut funds from teachers, nurses, the IHSS program, which helps seniors and those with disabilities? Those are real cuts that we're going to have to face. $250 million may seem like a drop in the bucket in a budget that's billions of dollars, but for nonprofits and for our constituents back home, that is a lot of money. And so I find myself in a very strange situation of having to bring certain things up and have been asking questions, and I just want to make it very clear to the members of our House and the other House, to the advocates, to the lobbyists, all of us that are sitting in these chairs right now in this amazing, incredible space have a right, a duty, an obligation, and quite frankly, a privilege to be able to ask questions. So when your response to me when I am asking a question is, why aren't you automatically with us? I have an innate problem with that. Because it is my job to ask questions, it is my job to understand, it is my job to make sure that we are moving policy that makes sense. So I'm glad and grateful for the conversations that I have had. This is an incredibly challenging bill to a lot of people for issues that have already been expressed. I think the vaping issue is incredibly important that we address. We had a bill in this House that was referred to a different committee, that was referred, that did not get referred on the Senate side, that actually addressed some of the other issues that we are thinking about from a member of this House. And I've had to explain to some folks some terminology that is used on the street in terms of what is a blunt. I asked a couple of members, and they didn't know. So when we are talking about, and it's a little funny maybe, but we're talking about, you know, a cigarrillo or whatever that is used by young people and adults that is cleared out, and then you put cannabis in it or weed in it, right? They're not necessarily smoking that cigarrillo, they're smoking a blunt because that's just the way that society works. And the fact that we are passing legislation on tobacco and not know exactly how it is that people use it is just mind-boggling to me, because we have to remember that there are people beyond this Capitol, this building, that are going to be looking to us thinking, what are you doing? But there is a bigger goal. I'm actually surprised that we haven't included flavored cannabis in this conversation, because that is also something that young people are using. But we're talking about vaping and we're talking about tobacco now. I hope the momentum for flavored cannabis is also something that we could look at in the future, because that is also an issue that young people have in their bathrooms at high schools that I have heard directly from young students in my community, in my district, on the zealous illegal cannabis dispensaries that just pop in and out. And so if the issue really is to address teen vaping and teen consumption, then I hope that that's a conversation and the political courage that we can also include when we look at legislation in the future. So again, thank you to the chair and to the author for the conversations. I do believe that this is incredibly important, but I just, again, want to make it clear to everyone that it is our job and our obligation and our duty to ask questions and to think about a holistic way in which we do policy and a holistic way in which we look at how the budget is impacted and will be impacting so many communities moving forward next year. Thank you.
Thank you. Mr. Flora?
Thank you, Mr. Chair, and Senator, thank you. It was great talking to you earlier today. A lot of what I said has already been stated, and I do want to reiterate a couple things, though, because I do find it fascinating that we are, as a father of two kids, we are tasked to protect our kids. And like Assemblymember from Sacramento here, when you go into a store and you smell vape, I actually can't tell the difference whether it's nicotine, or it's tobacco, and or cannabis. I can't. And so if we're going to have this conversation about protecting youth from vaping, I do find it fascinating that we have not brought in cannabis into this discussion. You go into a dispensary, it's like Willy Wonka's chocolate factory. They got flavors all over the place. Stuff that doesn't even sound good to adults. But nonetheless, they're selling it. And you can't tell me that that's marketed to adults. Not happening. But somehow, we've allowed the cannabis industry just to go off and do their thing. And I'm not exactly opposed, but I don't know a lot of people that are smoking cannabis for CBD side of things. It's primarily the THC side of cannabis is what they're working for. So that is very, very concerning to me, as well as the hookah aspect of this. We exempted hookah in the original bill, which I find interesting because right behind vaping, hookah is the number 2, has a number 2 number of youth doing it. Not to mention that they're running around with essentially a bong with tubes out of it that they're all sucking on. And especially in a global pandemic that we're dealing with, we're just expecting them to sanitize us every time. Not going to happen. So I am very, very concerned about that, as well as the economic loss, the tax revenue loss to the state of California. As we're moving forward, it's been said a couple times, but it's roughly $200 million that we have just thrown out the door if this thing passes. And right now, in a state that is desperately trying to find a revenue stream, we're going to whack. And a lot of that goes to Medi-Cal. And guess whose district has a lot of Medi-Cal in it? Recipients. Mine. And I know a lot of yours do as well. So what are we going to go? Okay, I fought real hard last year to keep podiatry services in the Medi-Cal. Maybe that's gone. So the diabetic patients suffer. So we're picking these winners and we're picking these losers. And I am very concerned about this. And that is why I do want to present a set of amendments. I know there was a motion made, so I want to make a substitute motion for a set of amendments that take this bill from a tobacco ban, flavored tobacco ban, into a 100% flavored vape ban, and exclusively just that. I know the Sergeant has a copy of the amendments. I would ask him to pass those out now, and I would love to make a motion to adopt those specific amendments into this bill.
Motion to table those amendments.
Okay, so you have a motion. There was.
She was quick on the draw.
Sorry.
I like it.
Is there a second to your motion? Did
Ms. Waldron.
Did Ms. Waldron second the motion? I'm sorry, you did?
I'd like to make my motion to table the amendments.
So we have a motion to table the amendments. So that is not debatable. That requires that, I believe, maybe you can explain. We have he has a motion, which was Ms. Waldron. Ms. Waldron seconded his motion.
Okay.
And then Ms. Lamone made a motion to table the amendments, and that was seconded by Mr. McCarty. So.
The motion on the table is to lay the amendments.
Okay.
The motion before us is to lay the amendments. Chair asked for an aye vote.
Okay.
To lay the amendments that was presented by Assemblymember Flora. I'm going to lift the call now.
Okay.
Sorry. We already have a motion that's been seconded for the bill. Can we introduce another motion at this point?
There was a motion.
You can make a substitute motion.
So.
Sergeant, can we ask those amendments to be passed out?
So we had a motion, and now we have a substitute motion, which is allowed, I believe, I understand. And we're asking to lay the amendments on the table. And I'm asking, so my ask is to, I'm asking for an aye vote, which will allow us to proceed with the original motion. And should that fail, we'll return to Mr. Flora's motion.
Thank you, Chair.
So Chair is asking for an aye vote. Madam Secretary, call the roll, please.
Motion to lay the amendments on the table. Chair recommends an aye. Wood.
Aye.
Wood, aye. Mace. Mace, no. Aguirre Curry. Aguirre Curry, aye. Bigelow. Bigelow, no. Bonta. Bonta, aye. Burke. Burke, aye. Carrillo. Carrillo, aye. Flora.
No.
Flora, no. Limon. Limon, aye. McCarty. McCarty, aye. Nazarian. Nazarian, aye. Ramos. Ramos, aye. Rodriguez. Rodriguez, aye. Santiago. Santiago, aye. Waldron. Waldron, no.
So the original motion is before us.
11 ayes, 4 noes. Motion by Ms. Limon passes. Amendments have been tabled.
Okay. Thank you, Mr. Chair. I do have a couple more just statements and comments.
Sure. Of course.
And I would like Senator Wright, I know he's on the phone and has been trying to get in a couple times, but I would like to ask him a very simple question, so if we could bring him on the line. But there is a young man, I know, once again, a Assemblymember from Sacramento made comment that he does not know of any, buddy that's been arrested because of illegal cigarette sales. And the guy's name was Eric Gardner in New York.
We said possession.
Possession. But this is what I'm worried about. Like, these folks, wherever they are, if they want to buy this, if they have a problem, they're going to get this product. We know this. We do it across a lot of different frames. So I'm worried about this. We're going to create an illicit market with this. So it is a huge, huge concern that I have.
I'm not going to allow additional testimony from somebody outside. This is the opportunity for members to deliberate. Mr. Wright could have been a witness. He could have been a witness in support of this. He was not.
Okay.
He did offer a me too. This is the opportunity for the members to deliberate.
Yeah.
Look, this bill, and I will just say this bill does not criminalize this. We had a bill before us last year in this committee that did prior to my amendments that pulled all the criminalization items out of that. We had a member who wanted to criminalize this issue, and I pulled that out. This bill does not criminalize this issue. It does not do that, and I think it's a red herring, and to imply that it does is not correct. We've heard from the author. It doesn't. But so, you know, might it create a black market? We don't know. Is that a possibility? We don't know. Someone could still buy these products online. If they have to do it, then they could still buy it online. This does not restrict that. But it does prevent the attractive nuisance of young people who want to spontaneously find a way to get a product in a convenience store. That's the goal here. And and that isn't part of my testimony, but
No, and I respect your opinion on
Sure.
this, and I do worry, though, because if we still can buy it online, as well as casinos, I think is in the bill as well, correct?
We do not have the authority over sovereign nations.
Right. So we're going to have people running up to wherever or buying online cartons at a time and selling them on the street corner. Like, that is a concern, because not everybody has access, especially in rural communities, to online stuff. So there is some concerns to this. And I've been talking too long, and I appreciate your time, Chair.
That's fine. And you know, I think you also know, Mr. Flora, that the work we do here is never carved in stone. And if there are unintended consequences, I fully hope that this body and the Senate will address those unintended consequences.
Okay.
But at this point, I would have to say it's somewhat hypothetical, because we don't have a bill that's done anything yet. So that's my opinion. So thank you.
Thank you, Chair.
Thank you, Mr. Flora. Mr. Mays.
Thank you, Mr. Chair. Kind of an awkward sitting. I feel like I want to talk to the senator. Is this okay? I know it feels kind of weird. Should I stand? It feels sort of imposing if I stand. Is this?
No, that's fine.
So just wanted to begin my thing, Mr. Chair. Thank you so much for the sincere conversation. One of the things that I've not enjoyed being in the legislature is it seems oftentimes in committee where we don't actually have real debate and real conversation, that it's all done beforehand. And with the pandemic and the way that we've had to operate, I appreciate very much the fact that you're allowing this sort of conversation. I've got an awful lot to say, because it seems like over the last week, 2 weeks, I've had a lot of conversations about this. And this is an issue for me that I tend to have conflict between head and heart on it. Because from a philosophical perspective, you know, I want to advance liberty. I want people to make decisions for themselves. I don't like tobacco. I know that's done incredible amounts of damage. And I know that there are doctors and there's healthcare providers. I know the chair has seen this firsthand as a dentist, where he's seen people who have had chew or whatever else that has had incredible amounts of impact and oral cancer that's come from that. And when you see that firsthand, you begin to, it has an impact. It has an impact on your psyche. It has an impact on what you, on when you become a member, an elected official. It makes you want to go have some change. The one thing I would like to say, and I do have some questions for you, Senator, is the one thing I haven't enjoyed over the last couple weeks in my conversations with my colleagues on this is some of the ad hominem attacks that have been lodged at one another. I'm thinking that one particular chair is doing it because he's trying to protect cannabis, or another particular chair because he's trying to have the back of big tobacco, or this member doesn't like this because of one reason, or this member doesn't like this because there's another reason. And what I've found in my conversations with all of you is there's some real sincere concern about this bill. And yet at the same time, I think you're struggling like I am between head and heart on this, because the bill as it's crafted, as we've seen, I don't necessarily love. But I do know that when I've gone back to my district and I've gone in to tour the high schools, when I've spoken to high school students, and you talk to their student government representatives, the number one issue that I've seen in every high school, they'll bring up the fact of vaping. And there's a question that I have is like, wait a minute, isn't it illegal already for you kids to be able to acquire vaping? Isn't already, don't you have to be 21 to be able to buy that? And yet kids are getting it. And of course, we also know we also know that the flavors are appealing to these kids and have made it cool. So it's obvious that kids are getting it, and it is at a crisis stage. And as elected officials, as policymakers, we need to do something of it. At the same time, a concern for me, and I've made this argument in regards to, the 75 or 80-year-old former Navy vet that started smoking pipe, and his favorite tobacco that he puts in is black cherry. And I think, are we really going to take away that black cherry tobacco from the former Navy vet that's been smoking for the last 40 years? That doesn't seem right to me. Now, I know that he can go and buy, even if this bill passes, can go buy that online, right? Can do that. But, he's been going down to the same store for years, and in essence, we would be taking that away, which actually leads me to, and I've been talking more than I expected to, so please forgive me, Senator. But I would like to talk about, because I think the Assemblymember from Sacramento brought this up in regards to some of those issues. Why is this bill, let's talk about that, why is this bill and the way that you've crafted it to start off with, why is this the best way to deal with the problem of youth tobacco or tobacco product use, specifically vaping? Why is this the best way to deal with it?
Well, I think and you raised the issue, is how can someone purchase, if you're a minor, a product that you can't buy unless you're 21 years old? But the recent surveys that were done showed that 74% or 71% of those who purchased Juul pods and Juul products were that 71% were able to buy in a store where it was illegal to purchase those products. And when they have sting operations by the California Department of Public Health, they find that 50% is what the buy rate has been with those minors. So whatever we're doing is not working. So the idea of trying to find a way to stop big tobacco from incentivizing and addicting children, which has the highest rate, and that's where when we talk about cannabis, and I appreciate that conversation, but the rate of cannabis addiction is about 9.1%. Alcohol is about 15.4% of use. Tobacco, 31.9% addictive rate. So that's why it's so important. And that's why when you look at the average and the beginning age of a smoker, it's 13 years of age. I took my first, drag on a cigarette, whatever you want to call it, I think I was about 13. Tasted so bad, I would never touch it again. But if it had that coolness of menthol, or that mint, which is what the products that are attracting them, that's what's getting them engaged, that's what's getting them addicted. And at 13 and 21, you never see anyone, I don't know of anyone at 25, 28 years of age wakes up in the morning and says, I think I'm going to start smoking today. It doesn't happen. So they get them when they're young, they attract them with the flavors, and then they're hooked for life. And then they kill them at some point along the way. That's why it's important in this bill that we get the flavors, and that we get them young, and that we do it now with tobacco. And I appreciate the conversation about cannabis and the other thing. I'm overwhelmed, frankly, with what we were talking about today. I mean, my close was pages of trying to argue the point and bring it home. I don't have to do that. I mean, I am so grateful for the conversation, so grateful for the heartfelt feelings that I've heard today, and the work that needs to be done in the future, whether it's on the revenue for cannabis, or the issues of trying to deal with all of the nuances that are developed. I'm just sorry I won't be here to help you with it.
So, Senator, can I talk about that? Because we do have some language about some other exemptions that have been brought before us just before the meeting, and I tried to look over this a little bit, actually to the point that Assemblymember Creo brought up. I've realized that I'm not the biggest expert on tobacco and tobacco-related items. When she referred to the blunt, that was me. I didn't know that. So I'm not as street smart as I thought that I was. I guess I don't really think I was that smart about being street smart. But so we've got the hookah exemption.
Yes.
And I shared with you on the phone my experience and how I've learned about the hookah and the culture surrounding hookah over the last couple of years. We don't need to go into that. But now we've got a couple of other exemptions before us. One in regards to premium cigars, which we think really only adults are using premium cigars. And now we've also got an exemption for loose leaf pipe tobacco, I think is how it's crafted. So the question that I have is, we've exempted hookah, we've exempted pipe tobacco, and we've also exempted premium cigars from this ban. Is there anything else that needs to be exempted that we don't know about that would make this bill more right? Because I think the goal is to deal with kids, right? We want to stop kids from getting hooked on this. But there are products, tobacco products, that adults use. Are there any other products that we should also put in here to make this bill a better bill?
I'm not aware of any. And the issue with the exemptions and in the conversations that I've had with some of the members of this committee and where those exemptions were developed that we just heard about today, you have to weigh the risk factor. What is the risk of youth getting that product and becoming addicted to it? And in hookah, very limited and low risk. Premium cigars, over $12, very low risk. And then when you look at the idea of packaged or tobacco, ground tobacco, or leaf tobacco, for pipes, another very low risk, and it will be crafted, I believe, in a way that will not incentivize the use in other types or forms of products. So I look at the risk factor, and that's really what's important to me and was. Certainly these amendments were not my choice. I heard about them today. I'm willing to accept those because I think, as we know in politics and we know in this building, it's the art of compromise, and I'm willing to accept it.
Is the loose leaf definition, talking about pipe, does loose leaf include loose leaf chew that you would bite down on the tobacco, or that you would suck on the tobacco to get the juices out of it?
It's my understanding it does not, but I would have to talk to the chair about the amendments that were.
And are there any other exemptions at all for any cessation devices, any types of products that are getting people off of tobacco? Or are there any other flavors that might and devices that could be used? Are there any exemptions for that could still be sold?
Not that I'm aware of, and the fact that a cessation device, if you want to be qualified and categorized and call yourself a cessation device, the Federal Drug Administration has a protocol that you go through to be qualified for that, and none of the products that we've seen talked about or are used by youth today or claimed to be cessation devices are actually legitimate licensed cessation devices.
Okay. Thank you, Senator. Thank you, Chair.
Thank you.
Oh, I'm sorry. I'm sorry, Mr. Nazarian. I apologize. I'm sorry. I just wanted to stand up and stretch my legs a little bit before no, go ahead. Ms. Aguiar-Curry and then Mr. Nazarian.
Sure, I'm going to make it quick. It's been a long day. Senator, I want to thank you for bringing this bill forward. You know, in a perfect world, we would have had this vetted with multiple committees. And here we are, and we all are really concerned about this issue, particularly for kids and vaping. And we are in the Health Committee. And so I've told so many people that have come into my office that called me either side is that, gosh, if it was my way, we would just do vaping and flavored vaping in Juul and just keep it super simple so we can address these kids. Because now we've muddied the water, and there's a lot of conversation that still needs to be taking place, I think. I mean, I think that Mr. Flora and others have some good ideas. My heart goes out, and I think there's parts that I didn't think about, and Assemblymember Burke brought this forward. And everyone's opinion's important. And this is tearing me apart because I see the importance and my concerns. I have grandchildren, I have children, I've got my nieces and nephews that tell me what's going on with vaping, and it breaks my heart. And they don't know what to do, the school doesn't know what to do, and so, you know, I'm really conflicted. I'm really conflicted, and I was very clear with you on this before. I'm going to be honest. I'm going to support you today, but I need you to keep working on it. And I'm not, and you know, I sit right there, and I may not support you when it comes to the floor, but it needs more work. It's muddied. The water got muddied on this. I think families were thinking it was just going to be one focus, and now it's kind of blown up, as we can see here. So I just want to thank you very much. especially also, Chairman, you have worked on this for a long time. Also, Assemblymember Gray's worked on this a long time, and there's so many people that want to make it right, and it's so hard to do so. So I want to thank all of you and all the comments today. I realize that my colleagues really care about our youth, and they want to make it right, and I'm hoping we can do that, and I'm hoping we have a really good product to send to the governor when this is all said and done. Thank you.
Thank you, Mr. Chair, and thanks to the author for bringing this important bill forward. Folks, I'll be very candid with you. I'm not so conflicted about this at all. I think there is quite a bit of work to do. I think some of the issues that have been raised are extremely valid, but maybe my perspective is very different. When my family was separated during the war in Iran, and my mother and I were fortunate enough to come here, at the age of 8, I saw my mother struggling with the level of stress of having 2 children here, 1 child in a 3rd country, and her husband in yet a 3rd country. We were separated into 3 continents. And that stress of not knowing where things were going to go while she was working 3 jobs, she started smoking. She would finish a pack a day. And I would find the packs and throw them away at 8. I'm glad I didn't get hooked on it because I've seen what it does to feel. We all have friends who have witnessed what's happened to them. So I can't share that I don't say it lightly, but I can't share that I'm conflicted about this. If anything, I was having a tough time because of some of the gamesmanship that's been going on between our 2 houses. That's been embarrassing during this pandemic when we should be advancing strong bills that demonstrate how the legislature is working on behalf of its constituents. Yet we're killing each other's bills. And it's not even partisan, by the way. It would be one thing if it was Republican on Democrats. It's Democrats doing it to each other. More to come on that later because we're going to be hearing from some authors. On this bill, though, I very much appreciate the fact that you've brought this forward. I think there is a lot of work to do because there's been some valid points brought up about how this impacts CBD and some other areas that we need to continue working on. But I'm going to be proud to join you in supporting this bill today. I do hope you get the votes to pass it. I do hope that also you work with our colleague from the Assembly who also had a similar bill and take into consideration some of his concerns. And I do ask that you, if you would honor me with adding me as a co-author to your bill as well. But on the cost issue that I heard from several of my colleagues as well, I appreciate you raising the awareness on the numbers we do see. You're absolutely right. Those are numbers we can account for right now. But what about the future healthcare costs that we don't even know what we don't know? We don't even know what we're going to be seeing and what we're going to be accounting for. There's no numbers. It's immeasurable how expensive it's going to be when future generations of kids, most of those kids already dependent on Medi-Cal-related state-funded costs and federal-funded programs, how much of a cost they're going to be contributing by ending up in hospitals. So let's also look at the future costs associated with what we're trying to address right now. Thank you.
Thank you for the opportunity to make a few remarks. I just want to first start by saying, Senator, I appreciate your persistence, your presentation. I know this has been an issue of importance to you for many years, and I want to thank you for that. Also for the other co-authors in the room, I appreciate your championing this issue through its different hurdles along the way. And I just want to thank the body for its conversation, the ideas being put on the table, the questions, the concerns, the thoughts. That's what a body like this is supposed to do. It's a deliberative body to raise issues and raise questions. I, like the last speaker, see this as a pretty straightforward issue. I'm not conflicted about it. I think it comes to the simple issue of the fact that we're facing a public health crisis for our children. We have an opportunity to do something about it, to make it better, to protect them, to defend them, to improve public health, and this is what we should be doing. I have 3 kids. I talked to one of my daughters about the flavored tobacco issue, and I said to her, why do young people like to smoke? What's the attraction? And she said, people like mango and they like mint. And I said, what about non-flavored tobacco? She said that she thinks that's gross, and young kids are not attracted to that. So something is happening so that young kids are getting access, even though they're underage, and the attraction is certainly, the data bears it out. It's the flavored tobacco. So we have an opportunity to do something. I strongly recommend that this body do, as it is a health committee standing up for the public health of our community, of our children. I do want to make a point about the budget issue and the depleting fund coming from our tobacco taxes that would result, and that's being projected. I do think that we can't always just put on one hat and one set of blinders and not look at the budget issues, especially in a time when we're so sensitive about the budget. But I will say this, that shouldn't be a surprise. When it comes to sin taxes, when it comes to taxes like tobacco, they are put in place in part to deter the behavior, so that over time they will be depleting. And when they are depleting, that is a good sign in the sense that it means public health is being improved, less people are smoking, becoming ill, dying, and that's good for our public health. We also have to look, as the good senator said, at the multiple savings on the other side in our healthcare system that we will be realizing. So I appreciate the presentation. I appreciate you championing this. Proud to, I think I seconded the bill. I don't know if I'm on record for that, but I am a co-author. I'll be voting aye today, and I appreciate you, Senator Hill.
Thank you. I know the hour is getting late. We have a lot of work ahead of us, and I'll do my best to be brief, but I do have some points I want to make. The World Health Organization says that tobacco kills more than 8 million people a year. 8 million people. It's the most deadly consumer product ever made, period. The CDC says that tobacco companies, you find on their website, add menthol to make cigarettes seem less harsh and more appealing to new smokers and young people. That's the crux of the issue here, is trying to not have the next generation hooked on a deadly product. So I look at this, in my mind, as a preventive measure. And when you do prevention, it's an investment to reap a future reward. And that future reward is a reduction in the $3.2 billion a year we spend on Medi-Cal on smoking-related illnesses. Think about that. So yes, we will have a shortfall here. But is it better to allow an industry that is responsible for killing 8 million people a year some slack so that we have a couple $100 million a year more in revenue in California? Is that the trade-off here? Because I think we can find a couple $100 million, quite frankly, if that's what it truly works out to be. So this issue is very personal to me. My entire professional career has been about trying to help people stop smoking. I watched my grandmother in a nursing home with crippling rheumatoid arthritis smoking mentholated cigarettes when she could barely light them because she was so crippled up. And she died of cancer. I watched my grandfather rolling his own cigarettes and being fascinated by it to watch him die of a heart attack. It's deeply personal to me. I can't tell you how many young people I saw in my practice come in with Skoal or Copenhagen tucked between their cheek and their lip. Young kids, baseball players, hooked. And when they wanted to quit, they couldn't. I think of the 26-year-old baseball coach in Sonoma County who died of oral cancer from that kind of a product and left behind a young child That's what we're trying to prevent here. So for me, the choice is very clear. It isn't just about vaping. Why? Because, we can debate statistics all day long, and, I think Mr. Flores said that hookah is like the #2 consumed product out there. But if you just want to ban vaping, that's a big win for tobacco companies, because I think a lot of them are beginning to write this off anyway because of Juul and some of the other issues out there. But what they really want to protect is this. They want to protect products like this. 2-pack, Swisher Sweets, chocolate flavored, $1.49. 2-pack, peach, $1.49. 2-pack, banana smash, $1.49. 2-pack, tropical flush, $1.49. I can go on because there are 25 or 30 others, including boozy watermelon and boozy something else. That's what we're trying to prevent here. Because if we just ban vaping, the kids are going to continue to use this product. It's a huge win for the tobacco industry. Huge. So I hated having to ask you to take amendments, Senator, but you know the process as well as I do. The goal is to move something good. And sometimes the perfect doesn't happen. It rarely happens in this House. If I had my way, we'd be on square one where your bill was started. There wouldn't be any amendments. We're trying to save lives here, folks. That's the bottom line. And that's why I'm so passionate about this. It's been my entire professional life. When I was the mayor of my own city, before I came to the legislature, we raised the age that you could buy tobacco products to 21. The first city in the state to do that. And our reward for that was threatened lawsuits because it violated the Stake Act. We couldn't do it. We couldn't do it. So when I came here, I was fortunate enough to partner with Senator Pan during the special session in 2016, and we got that passed. And that's spread across the country. 20-plus other states are doing that now. But we weren't the first. I wanted California to be the first. We owe it to our children to give them the opportunity to not be hooked on these products. People that start smoking, mostly 90% of them start before the age of 21. That's why these products exist. Tobacco companies want kids to use these products before they're 21. And so to get them out of stores so they're not convenient is the goal here. That's what we're trying to do. So I thank you for your attention today. I know it's been long. I know we have a lot of work ahead of us. Senator Hill, would you like to close?
Thank you, Mr. Chair, and thank you for that very passionate statement. And it's interesting how it is personal, I guess, for all of us in some form or another. Mine, I have no one close that had really smoked as much or brought down their life. But it's interesting, it was 26 years ago when I was the mayor of the city of San Mateo. And this seems like so foreign of a time today, but we had the first in the state, I think it was the first or the second, that banned smoking in restaurants or in the workplace or in bars. And the reaction to that, the upset, the anger, the fight, they actually went after my business that I had at the time, still have, they said, you're taking a business away from us, we're going to go after you. But that's how they fight, and it's not fair. But I want to thank you. This was such an enlightening, heartwarming, and touching conversation because it's all about the kids, all about the kids. And that's what I heard today, regardless of the side of the aisle, regardless of the votes. It's all about the kids. And you brought that home. And we have to make sure that as we go forward, we look at those issues that were raised, whether it's financial or racial, and really decide how we want to make sure that our kids grow up, succeed, and live long and healthy lives. I appreciate this conversation. I really appreciate the passion from all of you. I respectfully ask for your aye vote. Thank you.
Thank you, Senator Hill. It's been so long. I'm not sure who made the motion. I'm not sure who made the second. Monique, Assemblymember Lamone? I'll get, well, we got competing people now, so I will say, I'll make the motion by Mr. McCarty, the second by Ms. Limon. Or was that? That's okay? Or Mr. Bond? Okay. We'll go that way. Thank you. The motion is do pass as amended to appropriations. Madam Secretary, please call the roll.
SB 793, motion is due pass as amended to appropriations. Wood?
Aye.
Wood, aye. Mays? Mays not voting. Aguirre Curry? Aguirre Curry, aye. Bigelow? Bigelow, no. Bonta? Bonta, aye. Burke? Burke not voting. Burke, aye. Carrillo? Carrillo, aye. Flora? Flora, no. Limon? Limon, aye. McCarty? McCarty, aye. Nazarian? Nazarian, aye. Ramos? Ramos not voting. Rodriguez? Rodriguez, aye. Santiago? Santiago, aye. Waldron? Waldron not voting. 10 ayes, 2 noes. Bill passes.
Thank you, Madam Secretary.
Thank you, colleagues.
Thank you, Senator Hill.
I'm grateful.
Thank you.
Congratulations.